Hello, hello. All right. Hello. Hey, guys. Sorry, my grandson had a little pee-pee accident at daycare, and so I had to run and um, bring him some clean clothes. Hello. Hey, just me. Hello, hello, hello. Hey, guys. Oh, thank you, guys. Thank you so much. Thank you, thank you, thank you. Is Jamie in here? Let's go find Jamie. Thank you, Holly Ann, for the follow. I appreciate it. I am. I actually have 5 grandchildren. Always good. Thank you, thank you, thank you, thank you, thank you. Hey, I see you, Sam. Oh, not this cat fighting me for the spot in the camera. Do you, Holly Ann? Hey, Belle. Hello, hello. Oh, I feel like are y'all crooked over here? Is that better? All right. Yes, yes. Do me a favor, guys. If you're just getting in here, share it out, repost it, do all of the things. I appreciate it. Hey, 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 Antoinette. Hello, Prudy. Oh, come on, Mo. You can't just sit here on my lap, man. Find a spot, honey. Go ahead, get up there. That's your spot. This cat, I can't. Jamie, is Jamie in here? Hey, Parody. Thank you, thank you, thank you so much. I appreciate it. Thank you, guys, for the heart me's, the likes. I appreciate it over here on YT and FB. I appreciate it. Thank you, thank you, thank you. All right, guys, the Lindsay Clancy trial. Where's Jamie? Jamie's been our watcher while I had to go do pee-pee clothes for the little guy. So did we decide what night is ladies' night, general talk? No, we can decide now, though. Oh, thank you, thank you, thank you, thank you, thank you so much. Thank you, Parody. Thank you. I appreciate it, guys. Thank you, thank you, thank you. Oh, this cat is like clawing my leg. All right, y'all, go get Jamie. We got to find Jamie. See if we missed anything. So I'm on Court TV right now. I don't see them covering her yet. Hey, Agent Lady V. Hello. I don't see Lindsay Clancy live yet. Did you see about the Sour Girl? What about? No. New Orleans lady. Hello, Angel. Hello, hello. Hey, Angela. Good morning. So today they were supposed to make the decision. The judge is supposed to make the decision about whether or not he's going to let that stuff come into play. I thought originally that they were supposed to meet today. Hey, Deanne. See, I heard that they were going to start opening statements on Monday, but I assumed that they were coming back to court today for the judge to deal with his orders that he was supposed to put in. No, really? Oh, wow. Hey, Lisa. Well, that's all right because even if they don't come on, all right, me and Jamie got ready for court this morning and there's no court. Mm-hmm. Yeah, and there was something else they had to deal with. But you know what I wanted to go through, guys? I wanted to go through Lindsay Clancy's the suit against the doctors that she has. I know we talked about the husbands, but she has one as well. Hers is a little bit different. And so I wanted to go through that. Oh, the crime scene photos. Yep, yep, yep. You're right, Love and Nurse. So I wanted to go through that. Let me pull that up for you guys. So you guys over on FB and YT will be able to see it. You guys over here on TikTok, I won't be able to show it. Actually, yeah, I can. Maybe I can. Maybe I will turn it around. And then we'll go through it. Let me just pull this up. All right. All right, let me make sure y'all can see that. Let me make that screen bigger. All right, guys. I'm going to go in through and read Lindsay Clancy's civil complaint. Now, I'm trying to see if I can center this so I can read this and still see your, there you go. All right, here we go. Elena, thank you for the follow. I appreciate it. I appreciate it so much, guys. Do me a favor, guys, if you guys can heart the live, I appreciate it over there on FB and YT. Hey, Loopy. Hello, hello. Thank you so much for the heart me's. Thank you guys so much. All right, here we go. This is Lindsay Clancy. This is Lindsay Clancy versus Jennifer Tufts, the doctor. Dr. Goodhart, Nurse Gelada, Dr. Diaz, Astor Mental Health, South Shore Health Systems, McLean Hospital, and Women and Infants Hospital of Rhode Island. All of them, Jeff Green, thank you for the follow. I appreciate it. All of them are noted in this lawsuit. They're all being sued, all right, from Lindsay Clancy. So, oh, thank you, thank you, thank you, thank you, thank you. I appreciate it. This is an action for personal injury and loss of consortium brought by Lindsay M. Clancy. This action arises from the catastrophic failure of multiple medical providers to properly diagnose, treat, or monitor Lindsay's severe postpartum psychiatric condition. Despite her repeated, desperate pleas for help and her family's persistent efforts to obtain adequate care, Lindsay did everything a mother in her situation could do. Here, let me turn this around for you guys so you guys can see this over on, and y'all ain't just looking at my face. Hey, Jamie, there you are. Let me get this here so you guys can. All right. All right. Can y'all see this? All right. Let me just clean this off. Hold on. There you guys go. Can you guys see that better? All right. We have Lindsay Clancy did everything a mother in her situation could do. She recognized something was wrong with her. She sought medical treatment. She went to the emergency rooms. She called crisis hotlines. She admitted herself to hospitals. She took the medications prescribed to her. She communicated her worsening symptoms to her providers. She told them medications were making her worse. Her husband advocated for her. Her family drove from out of state to help care for her children, and still the medical system failed her completely. The defendants, Jennifer Tufts, MD, Dr. Diaz, Nurse Gelada, Astor, South Shore McLean, and Women and Infants, each failed to properly diagnose Lindsay's bipolar disorder with postpartum onset and instead subjected her to a disorganized, uncoordinated course of polypharmacy that exacerbated her condition and precipitated a severe psychotic break. Lindsay's clinical course was significantly complicated by polypharmacy and the involvement of multiple prescribers, which in effect obscured an accurate diagnosis and appropriate intervention and treatment, even though Lindsay did all she could do to obtain appropriate treatment. You need another device, Sam? You're so funny. The psychotropic medications Lindsay received appeared to have paradoxically exacerbated her underlying psychiatric vulnerability, precipitating a state of manic psychosis characterized by compelling command hallucinations. The tragedy that followed was the direct and proximate result of the defendant's collective negligence in failing to recognize obvious warning signs, coordinate care, properly diagnose Lindsay's condition, and provide treatment that met the applicable standard of care. This little gnat is still here, y'all. For those of you who wonder what I'm looking at, I'm not seeing things, and there's a little gnat that won't go away. All right, let me see. We have, as a direct result of defendant's negligence, Lindsay suffered catastrophic physical injuries, including permanent paralysis, and she lost her three beloved children, Cora Marie Clancy, Dawson William Clancy, and Callan Patrick Clancy. Lindsay now faces a lifetime of physical disability, psychological trauma, and the unbearable grief of waking up every day knowing she killed her children, all of which could have been prevented had defendants provided competent medical care. That's interesting. This just goes through the parties that are involved. I'm about to sneeze, y'all, so this is just the venue and the jurisdictions. Facts. All right, here we go with the facts. This really is Stress Chicken. Your name is amazing. That's so funny. Stress Chicken, you're right, though. It is a hard case. It really is. Lindsay Marie Clancy, born August 11, 1990, was raised in Connecticut. Her formative years were characterized by consistent academic excellence, culminating in a distinguished record throughout college and a rigorous accelerated nursing program at Mass Gen. Lindsay's 9-year tenure as a labor and delivery nurse at Mass Gen demonstrated notable professional competence and personal fulfillment. She was passionate about nursing and dedicated to her patients. Joanne, thank you for the follow. I appreciate it. Lindsay married Patrick Clancy December 2016, and they established their family home in Massachusetts. Lindsay and Patrick had 3 children. That was Cora Marie Clancy, born 2017, Dawson William, born 2019, and Callan Patrick, born May 2022. Yes, Parody, even her coworkers support her. Well, they're labor and delivery nurses. I mean, you know, it's think about that. It's pretty obvious to them, I would think. Oh my God, my niece is a labor and delivery nurse at Mass Gen. Oh, Lee, that's interesting. As described by Patrick Clancy, before Lindsay became ill, she was dedicated to being a mom. Can you guys hear me over here on YT? She was dedicated to being a mom, even over-dedicated, worked twice as hard as most. She rarely took a break to rest. Lindsay loved our children and never took her frustrations out on the kids. She remained as affectionate with the kids as always. Lindsay's mother-in-law, Susan Clancy, testified in grand jury proceedings that she loved everything about Lindsay. She was a fun-loving, doting wife and mother. She loved her kids, and she was a nurturing mother who smiled all the time. Lindsay's sister, Allison Olga, described Lindsay as the kind of person who cares deeply for the people she loves. She shows up for the celebrations and writes handwritten notes to show her love and appreciation. She's also there in times of need and finds just the right words to provide comfort and support. So to me, it sounds like she was, I mean, this seems a little type A to me. Um, Definitely being one of those people who are very organized in what they do. And Lindsay consistently conveyed profound affection for her children and her husband. She had never previously engaged in any form of physical harm towards her children. During Lindsay's first pregnancy with Cora, she experienced anxiety due to abnormal ultrasound findings that later resolved. She experienced some anxiety during the postpartum period, but returned to part-time work and breastfed for 1 year without incident. During the postpartum period following her second child, Dawson's birth, Lindsay was initially elated with increased energy. Patrick described that she had manic behavior for multiple days. In October 2020, she had an episode of decluttering to simplify her life, quote unquote, obsessively cleaning and discarding items. She said she felt amazingly on top of things. Her thoughts raced, and she constantly felt pressure to be active. I do believe, Gideon Rose, that the different types, like type A personalities, the different types of personalities, do play a role in the situation, right? Are they more susceptible to these things happening? And I do think that their personalities play a role in it. During the postpartum period following her second child, Dawson's birth, oh, I already read that part. Sorry, guys. After her second pregnancy, anxiety emerged at approximately 2 months postpartum. Although Lindsay was offered Zoloft by a psychiatrist, she declined due to concerns about breastfeeding. Her symptoms resolved through exercise, healthy diet, meditation, and several therapy sessions. So again, she was already doing therapy for postpartum issues with her second child, Dawson. These prior postpartum episodes, including the hypomanic symptoms following Dawson's birth, were critical indicators that should have alerted competent psychiatric providers to the risk of bipolar disorder and the potential for more severe postpartum psychiatric complications following subsequent pregnancies. Lindsay gave birth to Callan on May 26, 2022. Both Patrick and Lindsay took parental leave following Callan's birth. Now, Callan is the third child, the second son, the youngest, the baby. Lindsay demonstrated significant activation and hypomanic behavior, including an extensive program of exercise beginning only 1 week after delivery. 1 week. That's wild. I wasn't even thinking about exercising a week after delivery. She woke every day before the children at 4 a.m. Wow. I sometimes didn't go to bed till 4 a.m. She ran 3 miles, did spinning for 30 minutes on the Peloton, and then 30 minutes of aerobics. I'm impressed. On July 4th, 2022, only 5 weeks after delivery, Lindsay ran a 5-mile race. That's a lot. That's a lot of activity for somebody so newly postpartum. She wasn't getting any sleep, Parody. No. That's wild. Lindsay's sister Allison observed that, unlike her usual sensible self, Lindsay impulsively bought into a Beachbody multi-level marketing scheme, purchasing products to resell. She made videos of her exercise routines, posted them on Facebook, and encouraged friends to join the program. And again, I feel like money, yeah, that spending and those wild money things, they do a lot of that with these episodes or like these mindsets. These early postpartum behaviors constituted a hypomanic episode that, combined with her history following Dawson's birth, should have immediately suggested bipolar disorder to any competent psychiatric provider who obtained an adequate history. Now, I agree with that. I agree. She put her body through way too much stress. Yeah, absolutely. I absolutely agree with that. All right, guys, over on TT, if you can do me a favor, if you guys can make sure you get numb thumbs and you tap, 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 because we know what people like to do. For those of you who are just coming in here, don't forget to give a follow. If you guys can repost, same thing over on FB and YT. If you guys cannot forget to heart it, give a like, share it out, send it to someone who may enjoy the content. I really do appreciate it. I'm on all three. There you go. Julianne is like hopping everything. I think she was manic. Yeah, Jamie, it says she was manic. Yep. At approximately, and this is Lindsay's desperate efforts to seek help. Thank you guys for the heart me's. I really do appreciate it. I do have a goal for the heart me's, guys. It does help me get pushed out on the FYP, so I really do appreciate it. And absolutely, Becky, I absolutely have no problem reading it. Just bear with my reading. At approximately 12 weeks postpartum, Lindsay's mood switched suddenly to anxiety and depression. She experienced debilitating anxiety, insomnia, sleeping only approximately 3 hours per night, and exhaustion during the day. Well, I would assume so with 3 hours. I remember when I had kids and I worked overnights. I was getting about 2-3 hours of sleep, and I did it for like a few months, and I had to stop because it became, wow, that's a lot. She had no motivation and could not exercise. Everything about her body felt heavy and required effort. It was a chore to dress or shower. Her parents came from out of state to help care for the children. Recognizing that something was seriously wrong, Lindsay took the initiative to seek psychiatric care. On September 12, 2022, she found Dr. Jennifer Tufts online and scheduled an appointment. At her first appointment with Dr. Tufts, Lindsay's Lindsay's Edinburgh Postnatal Depression Scale EPDS score was 23, indicating severe depression. Dr. Tufts prescribed Zoloft despite Lindsay's hesitation about medication due to breastfeeding concerns. Let me pick you guys up. I feel like you guys can't see this too good. Lindsay, thank you guys so much. I appreciate it. Lindsay waited approximately 2 weeks before taking the medication, still concerned about its effects on breastfeeding, but ultimately began taking Zoloft in mid-October 2022 because she knew she needed help. After increasing the Zoloft dose from 25 milligrams to 50 milligrams as prescribed, Lindsay experienced a severe adverse reaction. She did not sleep for 48 hours, had racing thoughts, worsening anxiety, and felt awful. Now, I don't remember what the exact number is, but I do know that after so many hours without sleep, you can definitely go into a psychosis. It definitely becomes you're not in your right mind. Lindsay promptly reported these symptoms to Dr. Tufts on October 20th, 2022. Rather than recognizing the significance of this reaction and conducting appropriate testing to determine why Lindsay had such an adverse response to a relatively low dose of medication, Dr. Tufts simply discontinued the Zoloft and prescribed Ativan and Benadryl for sleep. Even after carefully tapering these medications, Lindsay's profound insomnia persisted, accompanied by distressing cardiac palpitations. Her condition continued to deteriorate. Yeah, she was getting physical symptoms along with psychiatric symptoms. That's wild. I could have sworn benzos couldn't be written by online doctors. I agree. I feel I can't even get an antibiotic, and I'm a nurse and I can't get an antibiotic without them being like, no, come on in. You know what I mean? Thank you, Swift Witch, for the follow. I appreciate it. All right, we shall continue. On November 16th, 2022, Lindsay's insomnia had become so severe that she took herself to the emergency room at South Shore Hospital seeking help. She reported insomnia, anxiety, and palpitations. The ER doctor prescribed trazodone for sleep, but it was not effective. Patrick's mother, a nurse at South Shore Hospital, contacted the South Shore Perinatal Behavioral Health Program on November 20th, 2022, seeking additional help for Lindsay. Nurse practitioner Julie Paul reached out to Lindsay. Lindsay reported to Nurse Paul that she was very frustrated and scared, experiencing extreme insomnia, averaging only 3 hours per night, and having racing thoughts. Nurse Paul then prescribed Prozac on November 21st, 2022. Wow. After merely 4 days on Prozac, Lindsay reported that the medication intensified her insomnia. She immediately informed her providers, and this right here, now, again, I don't know about different doctors, but it said she notified her providers, and the Prozac was discontinued. I'm curious who discontinued it. Was it the one that prescribed it, or was it her other doctor? So, This was the second antidepressant that had caused activation and worsening insomnia, a critical red flag for bipolar disorder that the providers failed to recognize. On November 25th, 2022, Nurse Paul prescribed 3 different medications. Ambien, I don't know, I have my feelings about Ambien, Remeron, and Clonopin. Wow. On November 26, 2022, after taking Remeron, Lindsay experienced dissociation, perceiving the world around her as unreal, distorted, and distant. She was unable to determine what was real. Red flag, red flag. She became disoriented, forgetful, confused, and disconnected from her own body. She was unable to drive and unable to be alone. Yeah, that is a lot of benzos. There's just a lot happening here. Lindsay reported these alarming symptoms to her providers on November 28, 2022, noting she was still struggling, sleeping only 3 to 4 hours, and feeling disoriented and forgetful. Wow, we're going a long time here now with just 3 hours of sleep a night. On November 29, 2022, Lindsay began treating with Nurse Gelada. Lindsay reported that she was anxious and frightened about what is happening, and she blamed herself. Nurse Gelada correctly considered a bipolar presentation and prescribed Seroquel, an antipsychotic and mood stabilizer. After starting Seroquel, Lindsay's condition took a dramatic turn for the worse. She developed suicidal ideation and began experiencing what she described as intrusive thoughts, which were actually auditory hallucinations. And this is what time? She started Seroquel on November 29th of 2022. After starting the Seroquel, she began having intrusive thoughts, which were actually auditory hallucinations. The voice said, "I will not be the same. I want to die." Lindsay openly communicated her escalating internal turmoil to her husband, her parents, and her providers. So guys, she's reaching out to everybody. She's reaching out to the doctors, her family, her husband, everybody she can. She described her emotional state as emotionless and like a zombie, attributing this profound effective blunting to the Seroquel. No, Sam, I can't imagine how scary this is. On December 2nd, 2022, Lindsay reported to Nurse Gelada that she had lost 15 pounds. She had lost 15 pounds, had no appetite, was experiencing panic attacks and confusion, and had a lack of attention over the past 4 days. On December 4th, 2022, Lindsay was so frightened by the hallucinations that she called the New Bedford suicide hotline seeking help. She was told there was no emergency because she said y'all, this question irritates my soul as a nurse. She was told there was no emergency because she said she had no specific plan as to how she would harm herself. On December 5th, 2022, Lindsay met virtually with an Aspire crisis support clinician, again seeking help. She was told that she did not meet the criteria for inpatient treatment because she did not have a plan. This makes me so angry. It makes me heartbroken for those people who are out there seeking help. And you're going to what? Wait for them to have a plan and go through with it before you help them? I don't know. Yeah, we need laws and policies in place for this. This is wild. First of all, these doctors are all nurses, all educated. How was this? None of this a red flag to anybody? This would have been a huge red flag. Kimmy, thank you for the follow. I appreciate it. On December 6, 2022, Patrick attended an appointment with Lindsay and Nurse Gelada. Patrick connected Lindsay's suicidal thoughts to the Seroquel. He told Nurse Gelada that Lindsay is 10,000 times worse since she has taken this medication, and asked if they could get Lindsay off medications and start from scratch to see what was going on. Well, there's some brain cell activity for you. That's a good idea. He asked if there could have been some mistake, like using the wrong medications. Nurse Gelada acknowledged it is possible. Despite this, Nurse Gelada continued to increase the Seroquel dosage toward 400 milligrams per day. Wow, I don't even know what to say. Like, she admitted it was a possibility, so why not go there? Why would you increase dosages that she felt was causing these side effects? Wow, that's wild. On December 13, 2022, Lindsay remained deeply depressed, had no motivation, and still had suicidal ideation. She wanted, quote unquote, this all to be over. On December 15th, 2022, Patrick called Nurse Gelada's office to report that Lindsay had a devastating week and that it was the worst day for Lindsay. Now, it's not just Lindsay calling, guys. It's not just Lindsay calling to report these things. It's her husband is calling them as well to report these situations. That if a family member has got to get on the phone and call these people to say something's not right, that in and of itself is a red flag when the patient's not calling, but other people are calling to report the situation. Like, I don't even know. That's just, I don't understand it. On December 15th, Patrick called Nurse Gelada's office to report Lindsay had a devastating week and that it was the worst day for Lindsay. She had horrible thoughts all day. And who else has got a red flag going, hello? Lindsay had auditory hallucinations all day, every day. She felt debilitated, not interested in anything, exhausted, and could not get out of bed. The hallucinations were loud and continued all day, saying, I will never be the same. I will never be me again. And you are damaged. You will never be the same. The only option is to die. And I just got chills from this. Lindsay told her husband, Patrick, I have thoughts of harming the kids. Y'all, I mean, now she's beating people with the red flag. She's literally hitting these people upside the head with the red flags and still nothing. She also told her mother about these thoughts. So not just one person, not just two people. She's telling more and more people about these thoughts that she wanted to harm her children. Because she was in a psychotic state, Lindsay also had paranoid delusions that people could hear her thoughts and that she would be locked in a hospital and have her children taken away. I can understand that. How many women, how many mothers have questioned going to a doctor and telling them doctor the truth that they need help because of repercussions of, are they going to say that I can't parent? Are they going to take my kids away? And we know as parents, that's the worst thing you can do to us, right? Is take our kids away. And so it's really sad that as mothers, we really have to question getting help because that's a fear. I don't know. Lindsay's escalating suicidal thoughts prompted a visit to Mass Gen emergency room on December 20th, 2022, where she sought help again. The ER suggested either admission to McLean Hospital or the partial hospitalization day program at Women and Infants Hospital in Rhode Island. On December 20th, 2022, Lindsay admitted herself to the partial hospitalization day program at Women and Infants Hospital in Providence, Rhode Island, a program intended for patients with postpartum depression. This was yet another active step Lindsay took to seek help for her worsening condition. Lindsay's chief complaint at Women and Infants was, quote unquote, I feel numb and crazy depressed. She reported feeling crazy depressed, numb to all emotion, can't feel love, that her life is becoming a disaster, that she couldn't feel fear, and that she was messed up beyond repair. She had lost 15 pounds in a month, had no motivation, and reported that it takes all the effort in the world just to breathe. Wow. That's a lot. That's really heavy. Oh, come on, Moo. Not Moo throwing my stuff all around here. That's a lot, guys. Oh, this is really hard to read. Man, hold on. I got to take a second to... I can't imagine feeling like that. That's wild. Lindsay's Edinburgh postnatal depression scale, her EPDS score at Women and Infants was 23, indicating severe depression. Her generalized anxiety disorder 7 item, her GAD-7 score was 21, higher than the threshold for the most severe category. Higher than the threshold for the most severe category. That's wild. Despite the severely elevated scores, Dr. Diaz, the attending psychiatrist at Women and Infants, concluded that Lindsay had no postpartum depression and rejected a bipolar disorder diagnosis because of no history of hypomania or psychosis or family history. What? Because she's got no history of it. Everybody gets it for the first time at least once, right? There's people that get it for the first time with no family history. It doesn't make it any less real. I just don't understand. It's like, yeah, it's like he pulled this degree out of a Cracker Jack box, man. This conclusion was negligent because Dr. Diaz failed to obtain an adequate history. Dr. Diaz's own notes documented that Lindsay's sister had experienced postpartum anxiety a relevant family psychiatric history that should have been explored. Had Dr. Diaz properly inquired about Lindsay's early postpartum period, she would have learned of the hypomanic episode that began immediately after delivery. Dr. Diaz also failed to recognize that Lindsay's providers had previously considered bipolar disorder, as documented in Lindsay's records stating she was started on Seroquel and concerned for bipolar. Devotional, thank you so much for the follow. I appreciate it. Dr. Diaz accepted Lindsay and Patrick's belief that her symptoms were due to overmedication and recommended weaning Seroquel. The clinical team at Women and Infants posited that Lindsay's symptoms were more pharmacologically induced than purely depressive. Dr. Diaz's assessment documented that the WIH-DHP is not a suitable treatment facility for Lindsay. Yet Dr. Diaz failed to recommend or arrange appropriate alternative treatment and instead discharged Lindsay after only 1 day of treatment with inadequate follow-up care. Y'all, and listen, as a nurse, I can tell you, not all doctors are created equal. There are good ones, there are mediocre ones, and there are really bad ones. This is wild. And think about it. Listen, even as a nurse, like I'm going to tell you my experience as a nurse going into doctors, it's really hard for me, because if I go in there and I say, look, this is what's wrong, this is what I think's happening, then they get upset and they think, are you trying to out nurse? Are you trying to take your nursing expertise and try and out doctor me? And so they get a little bit pushy. If you go in and say, these are my symptoms, then they're like, you a nurse? Are you trying to med hop, or are you looking for this or that or the other thing? And so they question your knowledge as a nurse, right? And then I have had experiences where doctors were like, well, you're a nurse. You tell me what you want. What do you want? And they were very lackadaisical with the care. It's like, tell me, what do you want? What do you think's going on? And I'll just write it. And I'm like, that's not what I'm looking for. You know what I mean? Like, I need you. I'm here because you're the doctor. And I don't ever try to doctor myself nor my children, because, you know what I mean? Like, sometimes you look at it from your own perspective. I'm not looking at it completely unbiased, right? And so, when you're a nurse, to walk in there, I feel like you get a different treatment when they know that you're a medical professional. You know what I mean? It's like, why didn't you pick up on it yourself? Well, because I don't treat myself. So I don't know. It's just, my nurse friend was turned away with appendicitis because she had makeup on and her hair done. Yeah. You know what I mean? Yeah. I never tell any medical professional. My primary care doctor, I've known him for a long time. He knows I'm a nurse, but I never walk into a hospital or a doctor's office or my kid's pediatrician. I don't tell nobody I'm a nurse. I keep it well off the radar. And like, I was just at the cardiologist. It's so funny, just to get an annual checkup. And she's like, do you work in the medical field? You seem to know a lot. And I'm like, you know what I mean? Because I don't like to tell people, because I'm here to get care. You treat me, and then I'll question when I need to. But other than that, like, you know what I mean? It's just, I feel like they're also treated a little bit different. So that was just my own, I just figured I'd throw that in there. That's my own personal experience being a nurse. Let's continue. All right, let me take a drink really quick, guys. For those of you on FB, hold on one second. I'm going to take a quick break, guys, really quickly, if that's okay. Give me a few minutes. I'm just going to go refill my drink and run to the restroom, guys, and then we will continue with this. So I'm going to shut my screen off here. I don't know if is anybody in the chat on TikTok that wants to hop up and talk. Where's my screen? Why can't I find it all of a sudden? Just so I can shut the screen off really quick and just take a break, and then we'll continue. This is pretty long, this stuff. I'm not one but a medical mom and chronically ill myself. As soon as they realize I'm not clueless, the mood shifts. Brooke, I agree. Absolutely. Oh, here you go. Oh, all right, guys.
I'll help you out.
Thank you. I'm gonna turn my screen off, guys. Give me.
I'm just gonna mod now that Jamie's up.
Okay.
Oh, you could have stayed up here, Sam. How's everybody doing today? I just wanted to say, I don't knock nurses at all. It was a nurse that saved my life because the doctor wouldn't listen. I wouldn't be here today if it wasn't for a nurse. Hi, Sunshine. Hi, Pam. Yeah, this is really tough to listen to. I mean, it's scary. I mean, I tell people, you know your own body. If you got to fight with the doctors, fight with the doctors because you know your own body. I mean, every time I go to the doctor, if I don't think it sounds right to me, I will tell the doctor this, this, and this. And thank God I have a doctor that listens. But yeah, it's tough. That's true. You are your only advocate. That is very true. These doctors, they don't know everything. I mean, they're supposed to, but they're not perfect. So that's why you have to fight for yourself as well.
Excuse me. First of all, I am a big, you're right, Jamie. I'm back, guys, by the way. I am a big believer in ask all of the questions, always be in control of your care, never trust anybody 100%. You should never, you know what I mean? Like, I love when patients ask me questions. I love when they question me or they're asking me about the doctor. You know what I mean? Is this right? I love when people ask questions because we're human, right? We all make mistakes. I have seen more than enough mistakes in the medical field where I'm just like, man, it's scary because we are human. However, in this situation, I could see if it was just one doctor or one nurse or one clinician that made a mistake. There's just so many mistakes. Everyone just jumped on the bandwagon of mistakes. Like,
right.
This is a lot.
She was trying. She was trying,
Yeah.
but I mean, I don't know. It's just so scary. I mean, I think about it. I was just telling them I wouldn't be alive today if it wasn't for a nurse. A doctor was arguing something else, and she said what it was, and she was correct.
Yeah.
So thank God. I mean, they had me on life support for a month.
Oh my gosh.
Yeah, I had septic shock really bad. So yeah, it was bad. But thank God for her, and I'm still friends with that nurse today. And that happened 13 years ago.
Oh wow. Oh wow. Yeah, there are good ones, there are mediocre ones, and then there are ones that, listen, I have worked with nurses that should have been not nurses, right? I worked with doctors. I have gotten to, like, listen, Ivory Rose has gotten into many a fights with doctors and surgeons. You know what I mean? I'm a big mouth. They hated me because I questioned everything for my patients. Because if you're not going to advocate, my job is to advocate for you, right? And then you got to look at, as medical professionals, the first thing you should always look at is patient safety. It doesn't matter what situation it's in, whether they're home, they're in the hospital, just in your doctor's office. Patient safety is ultimately the goal, right? And I feel like when the family starts reaching out, okay, I've worked in doctor's offices before I was an RN and stuff like that. If a family member was calling in saying, hey, you know what, this is a problem. Like when other people are trying to reach out to someone's doctor to say there's concerns, that to me is just, I don't know. Like, that's how did you guys not do anything? Obviously they were desperate for help. Yeah, Lucy, you can come up and ask a question. That's fine. It's just wild.
Okay, I have a question for you. You being a nurse, when your kids are sick, how do you not go in there knowing what's wrong with them and listen to the doctor and not your intuitions?
How do I? You just said, how do I walk in there? Not so when I go to a doctor's office, so I have specialties, right? I've worked ICU cardiac. I have, that's one of my specialties. I've worked orthopedics. I hold specialty certifications in that. I have certain specialties. I don't do peds. Peds is a whole different, they're a whole different type of human. It's a whole different ballgame. I never walk into my pediatrician's office, um, you know, with something in mind. I let them say it. And 9 out of 10 times, like they usually, it's something like, oh, that's what I figured. And I'll say it to myself. Um, you know what I mean? But there are times where I've gone to a doctor and, what I was thinking was wrong with me, they had a completely different idea and they were right. But then there were also times where I questioned and was like, wait a second, no, you're not even close. This is obviously this. And so why are we treating this? You know what I mean? So it's really hard to like, are you talking about like self-diagnosing? Loopy, is that what you're trying to say? Like, have you not self-diagnosed before you walk in there?
Yes, that's exactly
So
right.
I always do. I usually go in there knowing, you know what I mean? Like, first of all, I'm the most difficult patient ever. But when it comes to just a sickness or, something just like an infection, I usually go in there knowing like, look, I know what I need, right? But when it comes to something like, and again, I specialized in cardiac, right? So I'm very knowledgeable in it. But I just went to the cardiologist and I let him do his job. I let the cardiologist do his job and I agreed with it after, but I never walk in with no absolutely right because it becomes extremely dangerous because I'm looking at it from a personal perspective.
Right.
So while I usually do walk in there already diagnosing myself, I still let it play out the way it needs to play out. And then if I have questions, I question because again, I'm looking at it from a personal perspective. And I also am understanding that a doctor does know a little bit more than me, right? And so well, yeah, you're right. We usually know what doctors know, but I usually respect that education and will look into it. Um, you know what I mean? And I'll look into it just to make sure they're correct. But I always ask questions. I'm one of those people. I depend on pharmacists a lot. Like I have a really good relationship with my pharmacist. I call my pharmacist up all the time, like because a lot of people don't they don't use your pharmacists. They're doctors. They're very intelligent people. They know everything. My doctor has called the pharmacist right in front of me, asking the pharmacist questions. When it comes to medications, they are very knowledgeable. Utilize them as a good resource, and they have other resources. They can help you if you know what I mean. So utilize those resources. Utilize the pharmacist because I wonder why as a nurse she didn't say call the pharmacist and be like, hey, can you call the doctor? Are we a little concerned here? Because I've called my pharmacist and said, I need you to call the doctor because I just not feeling comfortable with this. What do you think? And you'd be like, yeah, I can see it. And so I'm like, can you just have a discussion on, doctor level? And I've done it before, you know what I mean? So utilize the resources you have. I don't know how pharmacies didn't pick up on this. I just feel like it fell through the cracks a lot. Luckily, we don't see this all the time. So it looks like it was it's very rare that people fall through the cracks. It's just sad that this just happened to be the woman that fell through the cracks of the entire healthcare system. So I hope that answered your question, Loopy. I do only with myself, never my children because I'm not certified in peds. Their children are whole different beings, right? They're completely different than adults. So yeah, I do.
That does make sense. And I really never thought about the pharmacist.
Mm-hmm. I utilize my pharmacist all the time. Probably he's like, are you calling me back again? Because again, I don't understand pharmacology to his extent, right? And so especially with kids, I'm always calling like, hey, you know what? She gained 2 pounds. Like, I'm on the verge here. I really do respect the pharmacists. And again, not all pharmacists are the same. Mine just happens to be really great. You know what I mean? And so, yeah, I really feel like I utilize my pharmacist a lot. I've had them call doctors for me. I've been in ERs, or I've had to go to, orthopedic centers where I'm just like, I don't know this doctor. I can't get in hold of my doctor. How do you feel about this? Because you're part of my care team, in my opinion. Like, nobody understands the medication I'm on, what reactions I've had. Like, my pharmacist knows every, reaction I've ever had to a medication. Like, you should utilize them, because a lot of them, they're there for that reason. They don't just bottle up the pills and pass them. They're actual doctors in their field. So I don't know how, like, the pharmacy wasn't like, wait, we're upping this again, and you got this going on, and you're on 3 benzos, and like, are you good? So I don't know. And Brooke is right. Pharmacists know a lot more, actually, about interactions and side effects. You know what I mean? Primary care, psychiatrists, they all have specialized fields. As a nurse, I have specialized fields that I work in. You can send me to labor and delivery, and while I know the basics and I can catch your kid, you don't want me delivering your baby, or, you know what I mean, doing any of that, because that's not my specialty. That's not where I work my best. And it's the same thing. Primary care is a little bit of everything. They don't really have a specialty. Psychiatrist, you're a specialist in your field. So I just feel like these people definitely let this woman down, in my opinion. They let the husband down. Everybody's reaching out. That is a red flag. Like, can you guys imagine your sister, your mother, your husband having to call the doctor to be like, hey, she's having a really bad day, I'm concerned. Like, you can't say that this wasn't an episode of psychosis when it literally, you follow the bread trail, the crumb trail, right to the worst thing happening. Like, it's literally textbook. This is a textbook case. So, yeah, I don't know. Sam just said, yeah, my pharmacist has called the doctor before. Yeah, mine do too. Paula just said, my pharmacist is very thorough. If there can be a reaction, etc., they won't fill it. Yeah, my pharmacist is great. My pharmacist is great. We've used the same pharmacy for about 19 years. And I've went through 2 of them, but this last guy's great. Like, he's really on top of it. And I think he respects the fact that I know what he does, and like, I'll use you before. I will take the word of medication advice over my pharmacist and my doctor, because that's what the pharmacist does. That's his specialty. You know what I mean? Chemistry, pharmacological, that's what he does. That's what he studied for, So I go to CVS and they know me and my kids. I go to Walgreens, they know me and my kids too. She was on more than one med at the same time. Could that cause issues? Absolutely. Yeah. Not only can the polypharmacy, the combination of all these medications, cause the issue, just one of those medications and starting them could have caused the issue, because that is a side effect of these kind of medications, is, suicide, getting depressed, getting worse. Everybody who's ever been on anything knows, or you've seen the commercials, if you start taking it and you feel like this, get help, because it happens. That's a side effect, right? So, yeah, I don't know, but let's continue. Let me carry on here. Let me pull this back up. Hold on one second, guys. This is a lot. I think I get really emotional reading stuff like this. Like, as a nurse, somebody begging for help. Like, that's why we do what we do. Like, they literally were begging for help, and it's just so sad. Just so sad. Here we go. All right. Can you guys over? Yeah, you guys can see that. Okay. All right. Let me turn my screen on for you guys. Over here. All right. Dr. Diaz's and women and infants' negligent failure to properly evaluate Lindsay obtained an adequate obtain an adequate psychiatric history, and recognize the signs of bipolar disorder with postpartum onset resulted in a missed opportunity to provide appropriate treatment. Their recommendation to wean Seroquel without providing a proper alternative treatment plan or ensuring adequate follow-up care contributed to Lindsay's further deterioration. Following the Seroquel reduction recommended by women and infants, Lindsay's suicidal Lindsay's suicidal ideation resurged. By December 29, 2022, Lindsay told her husband, "I can't tough it out anymore. I need to go to McLean." So this is really close together, the dates. Look at these dates, guys. Like it's consistent, December 20th. Like it's not like months are going by. It's literally days. You know what I mean? Wow. On December 30th, 2022, Lindsay went to MGH emergency room, which suggested admission to McLean Hospital. On December 31st, 2022, Lindsay admitted herself to McLean Hospital, the nation's top-ranked psychiatric hospital, due to her severe depression and suicidal ideation. Lindsay's admitting symptoms included passive suicidal ideation, feeling detached, hopelessness, depression, no appetite or energy to perform activities of daily living, no motivation, anhedonia, racing thoughts, inability to organize her thoughts, memory problems, anxiety, and insomnia. Her insight and judgment were documented as limited. Wow. McLean placed Lindsay on a locked unit with 15-minute suicide checks. However, the care she received was grossly inadequate. She was admitted on New Year's Eve and there was a skeleton crew because of the holidays. Patients spent their evening doing puzzles and coloring. Nurses stayed behind the desk and glass. Lindsay did not see a doctor until January 3rd, 3 days after admission. That's true. I did work in a psych hospital. Anybody's a nurse know that we always, Tanya, thank you for the follow. We oftentimes pick up extra shifts doing psych. That's common for nurses. And yeah, I've worked holidays in a psych unit and there's nobody there. And nurses don't do, usually nurses really just do the charting. My experience with ever having worked in a psych hospital as the RN on this floor, my job is really just to sign off the paperwork, sign off the orders, go through the charts, you know what I mean? Be there in case somebody needed help. I had an LPN who would pass out the meds, and then everybody else on the floor who was with the patients were just the aides or the health assistants, which required a bachelor's in psych to be able to hold that position. And that's really, you had 2 or 3 of them. And on holidays, you had the RN, which was doing the paperwork behind the desk. We don't really go out and mingle with the patients. We can, but timing, right? Like you're doing a lot of calling in orders, making sure you're calling the doctor, something's not right. That RN is doing that usually on the floor, while everybody else is just out and about with the patients. There's no groups being held usually. There's no, they're not doing, doctors really aren't coming in unless there's an admission to speak with the patients. So there really is a skeleton crew. There's not much happening on holiday weekends in any hospital, anywhere really. And so that was a really bad timing right there. Again, feeling like that when there's really not much going on or any resources literally in the facility at that point. So Lindsay did not see a doctor until 3 days later on January 3rd, 2023. Where did this go? On January 3rd, 2023, the doctor advised Lindsay to stop Seroquel and benzodiazepines and prescribed trazodone for sleep. Again, she was already prescribed the trazodone too. On January 4th, 2023, Lindsay asked if she can go home for Cora's birthday because her thoughts had improved since the Seroquel decreased. She was approved for discharge. Lindsay was discharged from McLean Hospital on January 5th, 2023, after only a 5-day stay. Dr. Goodhart authored and signed the physician discharge summary approving Lindsay's release despite her documented limited insight and judgment and suicidal ideations. Lindsay was returned to the care of the same outpatient providers who had been providing allegedly substandard care. Oh no. After discharge, Dr. Goodhart from McLean called Lindsay and spoke for only 10 minutes, offering names of antidepressants. The staff at McLean suggested amitriptyline, yet another antidepressant, the very class of medications that had repeatedly caused Lindsay to have adverse reactions. When Lindsay was discharged from McLean, she thought, I was just in the best hospital in the country, so there was not much hope. She decided she must appear like she was okay and had to do her best. And I kind of get that, right? Like you gotta go on, right? Dr. Goodhart's and McLean Hospital's negligent failure to properly evaluate Lindsay, obtain an adequate psychiatric history, provide sufficient inpatient care during her brief admission, and ensure appropriate discharge planning and follow-up care directly contributed to the tragic events that followed. Dr. Goodhart, as the discharging physician, approved Lindsay's release after only 5 days, despite her documented, quote-unquote, limited insight and judgment and her ongoing severe symptoms. Sky, thank you for the follow. I appreciate it. Wow. Lindsay returned to treatment with Dr. Tufts on January 6, 2023. So guys, we started in October. Now here we are in January. The day after her discharge from McLean, Dr. Tufts diagnosed Lindsay with chronic major depressive disorder, single episode moderate. She recorded that Lindsay's psychiatric condition was, quote unquote, deteriorating and that her medication was not effective. Despite her poor condition, Dr. Tufts met with Lindsay for only 17 minutes. At Cora's birthday, and 17 minutes again, that's just enough to bring it up to a level 2 to where they can, charge a little bit more. Definitely 17 minutes is in no way, shape, or form adequate to have discussions about the care that she needed or what she was feeling. At Cora's birthday party on January 7, 2023, Lindsay was not herself. She smiled but could not converse. She avoided talking and could not make sense of what others were saying. Lindsay's hallucinations, I couldn't even say that word. Lindsay's hallucinations resumed within 1 week of her discharge from McLean. On January 10, 2023, Lindsay returned to Dr. Tufts and was switched to Valium for a benzodiazepine taper. Dr. Tufts indicated that at some point, we will add an antidepressant. On January 16, 2023, Lindsay was still experiencing debilitating depression. She had to force herself to do anything. The hallucinations continued. You should harm the children. Now, if you notice, it went from statements that these hallucinations were making, even the hallucinations seemed to progress. And by that, I mean, in the beginning, the hallucinations were just statements, and they were repeating to her how she was supposedly feeling. And now they're starting to become statements and commands, right? They went from just statements, you feel like this, I'm going to tell you how you feel, and now they're becoming commands. Sarah, thank you for the follow. I appreciate it. So the commands were, the hallucinations continued, you should harm the children, you should kill yourself. You will never be the same. The only option is to die. She felt like a zombie. Dr. Tufts prescribed amitriptyline, another antidepressant, at 10 milligrams per day. On January 20th, 2023, because Lindsay was having such awful thoughts and was so numb and emotionless, she researched what is a psychopath to see if she was one and whether there was a cure. Now she's doing her own homework. That's really sad when you feel you're at the point, like, what is a psychopath? Like, you know, man. And again, I know a lot of people are going to be like, but she's a nurse. She should know. No, not really. She's a labor and delivery specialty. You know what I mean? A little bit. We all go through like our nursing school, and we do different, but we get a little bit of everything else. This isn't our specialty, right? Like, this wasn't her specialty, so she wouldn't have the same knowledge as a nurse of this, psychiatry and psychology that someone who specialized or frequented that specialty would. And to see whether there was a cure. So she Googled what is a psychopath to see if she was one and whether there was a cure. So at this point, she knew where this was heading. She kind of knew what was happening. I don't feel like that was premeditation either, Sam. I really don't. I feel like that was, they're not helping me, I got to help myself, kind of. Ellen just said, exactly, I'm a cardiac ICU nurse, but have limited experience with surgery. There you go. Yep, absolutely. Like, we know enough. We know enough to be like, hey, something's not right. Let me get somebody who knows a little bit more, right? Like, there's a lot of places that I wouldn't be the best at working in a hospital, because I have just general knowledge, and then I have my specialties that, I do know a lot more than the average person, right? My experience in orthopedics, a lot of times the ER be like, hey, can you come down here? I need you to look at this. Can you come down here and set this up? Can you come down and show me this, that, and the other thing, because again, ER is like a little bit of everything. And so you got to remember that just because she's a nurse doesn't mean that she knew everything about every aspect of nursing. None of us do. It's too much. On January 23rd, 2023, during another 17-minute appointment, Lindsay reported being a little more anxious, with heart racing and more AM anxiety. Dr. Tufts recorded that Lindsay's mood is the same, flat, anxious, that she had no motivation and she was numb, and has to force herself up out of the house. Her sleep and medication efficacy were poor. Her insight was poor, and her psychiatric condition generally was unchanged. Dr. Tufts increased the amitriptyline to 20 milligrams per day. That night, Lindsay did not sleep. Now, guys, that's January 23rd. That's the day before this all went down. Okay, so she Googled, was she a psychopath, on January 20th. January 23rd, the doctor realized that she was unchanged, still flat, still limited insight, right? Poor insight. The doctor recognized that nothing has helped yet. And then he upped the amitriptyline that night. Lindsay did not sleep. So now she's going into this next day when everything happened with no sleep. Okay. Now I want you to remember that, too, again, a lack of sleep, a lack of rest for your brain can, in and of itself, cause a psychosis, right? In and of itself. And trust me, I did it as a kid. I was a teenager. Me and my friend were trying to make a bet who could stay up the longest. And I literally watched my coat walk off the coat rack, walk across the room. I grabbed my dad. I got scared. He's like, you need to go to bed. And so, but yeah, I started seeing things when I was a kid because I was up for it was 2 days, just out of a bet. So here we are, January 24th, 2023, guys. This is the day. This is the day. Thank you, Megan. Thank you. This is the day it all happened. Let me take a sip of my soda because I'm getting dry. The medication, Brooke, was amitriptyline. Julianne just made a good point. She said, I do find that my brain can override my medications if I'm very high. I feel like you can also fight medications, right? How many people have taken Ambien and they kind of fighting it because they're not ready for bed yet, but they took it anyway, and you know what I mean? And then all of a sudden they complain that weird things happen to them. how many people have, you know, I feel like you can fight certain medications and, you know, fight what they're supposed to do, if that makes sense. To some extent, obviously. Yeah, Parody, she could have been in some kind of, you know, dream state. Yeah, absolutely. All right. This is the day. On January 24th, 2023, Lindsay woke severely depressed with suicidal thoughts. She gave the children breakfast. She took Cora to the pediatrician because Cora complained of a stomach ache. Later, she went to the backyard with the children. She built a snowman and sent a picture to Patrick and her mother. The suicidal hallucinations continued all day nonstop. Later in the afternoon, the voice began saying, "You should harm the children." Lindsay thought about dinner and realized she had not prepared anything. She asked Patrick about takeout. She looked at a map to see how long it would take because she did not want to be alone and needed help. I never considered that. I'm not going to lie. I never considered that she herself was concerned about being left alone. And that's why she Googled the time. Yeah, that's a good question. Why didn't he take the kids? And, you know, it's funny because, you know, we can, you know, she's saying here she didn't feel good all day, but she definitely was trying to make it look like she was having a good day, right? Like playing with the kids, going through the motions, still trying to show, like, I don't know. Lindsay thought about dinner and realized she had not prepared anything. She asked Patrick about takeout. She looked at a map to see how long it would take because she did not want to be alone and needed help. I'm not going to lie, I never considered that. As soon as Patrick left to pick up the food, there was a loud, demanding, repetitious voice. "This is your last chance. Kill the children so you can kill yourself. This is your last chance. You have to kill the kids so you can kill yourself." Lindsay felt the force come over her. And you know, I'm going to say this too. You got to remember how your brain works. If she really was concerned because of these voices and these feelings about being left alone, and she was Googling, you know, how long it would take her, right? I only got to make it through an hour by myself. She was already in the mindset that something was going to happen. And did her brain force that psychosis and force that thought process that she was already in if she was already concerned about something happening? Her brain could have taken that thought and ran with it. You know, it's the brain is the way it works is just, it's incredible actually. And it's overpowering. I mean, think about it. Your brain runs it all. Your brain controls everything, you know? So it's the power it has, I think, is beyond what people realize. You know, I used to have a problem. You guys are going to laugh. When I was younger, okay, it actually happened when I was a medical assistant. I would look at a rash and then I would get itchy in the same spot and get a rash in the same spot. And it really was just because like these things that people would come in with would bug me out so bad. Like I didn't want to catch it. And it kind of was like a little bit like, oh, I don't want that. But for some reason, I could look at somebody's rash and then I would get the same rash. Like I would get the same, like my body would just start itching in the same place. And I remember talking to the doctor that I worked for, and he kind of laughed at me and he was like, "There's no way you don't get a rash in the same spot every time somebody comes in." And so he was like, "I think you're doing it to yourself. You're creating this rash because the rash bothered you so much. You made that happen." And I did. There was nothing. There was no rash. There was no reason, and it wasn't like. But I was just itching the same place, feeling the itchy there. And then all of a sudden a rash happened and it was just my brain doing it. There was no reason for that rash other than my brain. I thought I was itchy in the same spot and had the same thing. And he was like, "Yeah, no, that's not a thing. You're giving yourself that rash." And he was right. I was giving myself the rash. So I always think back, you know, it's really funny how your brain can do these things. You know what I mean? Um, when I was a dermatology nurse, I would do the same things, the same with rashes, bug bites. Yeah, Irish princess. I didn't, and at the time I was only a medical assistant. Like I didn't have the knowledge I did as an RN. So I didn't realize like that your brain is so powerful, it can do that. But man, I would get the rash, and the doctor's like, well, somebody else can take care of the rashes. You got to stop because, you come out of the room and you're breaking out in the same spot as these people. And he used to taunt me and tease me all the time, but it was my brain doing it because the rashes kind of, gave me that ick feeling. I didn't like them. So it's funny how I made my brain do that, not subconsciously. I didn't know that I made my brain do that. So it's really interesting how your brain can create a situation for you. Here she was Googling how long it's going to take because she was worried. And again, she knows in the back of her head kind of what's going on and what this could all lead to. So she already had that thought process in her head. And now she's Googling, like, look, I just got to make it through the 45 minutes, 30 minutes, he's going to be gone. And then the second he's gone, her brain could have started that story up. Well, here you go. Now he's gone. This is what we're going to do. Her brain could have created that without her doing it purposely. Am I making sense to you guys? You know what I mean? So it's like, it's the brain. There's so much about the brain we don't know. It's unbelievable. But your brain can create situations and create things for you. You know what I mean? And so I want people to think about the fact that, again, her Googling that already put that thought process in her head. She was already worried that the worst thing can happen. She was already suicidal and thinking about killing herself. And then all of a sudden her brain created the story. To her, it was real. Again, remember, to her, it was real, right? Because this is her brain, her thought process. It's real to her. These voices were real because she was hearing them, even though we didn't hear them. It was real for her in her brain, in her little, and the meds made it worse. Absolutely. Let me continue. Sorry, I didn't mean to go on that tangent, but the brain has always intrigued me. It's just so like amazing, and there's so much we don't know about it. Lindsay experienced command auditory hallucinations. A demanding, powerful male voice explicitly ordered her. She felt an overwhelming, irresistible compulsion to comply, entering a dissociative, dreamlike state where her physical actions felt utterly disconnected from her conscious volition. In other words, there was no connect between what she was doing and her brain. She felt completely separated, her mind and her body's movements and actions, and the ability to control them. And again, this is a thing. Anybody who works psych, you guys, I know I got some psych nurses in here. I know I've got some people who, you know what I mean? You guys, this is a thing where they feel separate, like there's no control from one over the other, the brain completely detached. And so, I mean, this is the first time this has ever been heard in the psychiatric world. This is a common complaint. This happens. I'm sorry. She felt an overwhelming, irresistible compulsion to comply, entering a dissociative, dreamlike state where her physical actions felt utterly disconnected from her conscious volition. She perceived her quote unquote body was just acting, and she was merely quote unquote watching herself do it. She reported she had no choice but to follow these compelling directives. Sometimes acts of OCD can get, yeah. Lindsay described, I lost all control. My body started acting without any control on my part. I was just following commands, all actions. The voice demanded action. Lindsay proceeded to strangle each of her children, uttering, oh, this gets me. I'm sorry, guys. It's so sad because she begs for help. Lindsay proceeded to strangle each of her children, uttering, go to God, baby. Following these acts, she undertook a severe suicide attempt, ingesting, I didn't know this part, guys, ingesting a substantial quantity of various medications, self-inflicting lacerations to her wrist and neck, and jumping from a second-floor window approximately 20 feet to the ground below. So she was not wanting to live. There was no thought in her mind that she was going to live. She, in fact, did 3 things that should have killed her. Like, yeah, it is. It's like Brooke just said. That's what Brooke was talking about when she was telling her experiences with psychosis. She just said autopilot. You feel like you're on autopilot, but you're not the pilot. Like, it's just autopilot. Absolutely, it's the autopilot. You're just doing it without, and so, yeah, that makes so much sense, Brooke. Absolutely. Jennifer Page, thank you for the follow. I appreciate it. All right. Lindsay suffered catastrophic injuries, including a thoracic spinal cord injury, resulting in permanent paralysis below the sternum. She also suffered multiple closed fractures of her cervical and thoracic vertebrae and multiple rib fractures. And watching herself from outside of her body, I've heard a lot of patients say that. Cora and Dawson died on January 24th, 2023. Callan succumbed to his injuries and died on January 27th, 2023. Lindsay consistently maintains her actions were compelled by a hallucinatory voice, not a conscious decision, and expresses profound, enduring love for her children. Dr. Margaret Spinelli, clinical professor of psychiatry at Columbia University College of Physicians and Surgeons, and founder of the Women's Program in Psychiatry at Columbia University Medical College, conducted a comprehensive forensic psychiatric evaluation of Lindsay. Dr. Spinelli met with Lindsay for 5 hours at Tewksbury Psychiatric Hospital on June 11, 2024, and subsequently spoke with her by telephone for 3 hours on September 6, 2024. It's a lot longer than the other guy had talked to her. Dr. Spinelli also interviewed Patrick Clancy, Lindsay's sister Allison Olga, Lindsay's mother Mrs. Musgrove, and Lindsay's mother-in-law Susan Clancy. Dr. Spinelli diagnosed Lindsay with bipolar disorder 1, severe, with psychosis and anxious distress, with postpartum onset. Dr. Spinelli concluded that Lindsay had a baseline bipolar disorder with minimal symptoms after her second childbirth, and that her symptoms worsened after her third birth when she was prescribed an antidepressant. Dr. Spinelli noted that an antidepressant medication can create manic or hypomanic symptoms and mood instability in one who has bipolar illness. This is a well-known response for a person with underlying bipolar disorder. Yes. Dr. Spinelli opined that the providers never seemed to communicate with one another, that no one ever asked her to describe the content of her intrusive thoughts, which were in fact hallucinations, and that Lindsay was repeatedly given antidepressants instead of a mood stabilizer. Dr. Spinelli specifically commented on the failures of multiple providers. Regarding the initial Zoloft reaction, she noted that if practitioners had recognized the hypomanic activation after Zoloft, a second or third antidepressant would not have been tried. Regarding women and infants, she noted that Dr. Diaz did not review mood symptoms of last pregnancy and this postpartum period, and did not review hypomanic episode immediately after delivery, which was the beginning of Mrs. Clancy's postpartum psychosis. Dr. Spinelli concluded she did all that she could to obtain the appropriate treatment. She did. Dr. Paul Ziesel, a forensic psychologist, also conducted extensive clinical interviews with Lindsay and her parents. Dr. Ziesel was the initial forensics expert to engage Lindsay in the immediate aftermath of the incident. Dr. Ziesel concurred with the assessments of Dr. Spinelli and Dr. Philip Resnick. Dr. Ziesel opined to a reasonable degree of psychological certainty that Miss Clancy's clinical course was significantly complicated by polypharmacy and the involvement of multiple prescribers, which in effect obscured an accurate diagnosis and appropriate intervention and treatment. Furthermore, the psychotropic medications she received appeared to have paradoxically exacerbated her underlying psychiatric vulnerability, precipitating a state of manic psychosis characterized by compelling command hallucinations. Dr. Ziesel noted that Lindsay's parents conveyed profound shock and devastation at the depth of her psychological decompensation, indicating a prior lack of complete comprehension regarding the actual severity of her underlying illness. This underscores how the medical providers failed to adequately communicate the severity of Lindsay's condition or take appropriate action. The standard of care required defendants to obtain a complete psychiatric history, including detailed inquiry into Lindsay's mood and symptoms during and after her prior pregnancies. Had any of the providers done so, they would have learned of the hypomanic episodes that followed her second and third deliveries, which were critical indicators of bipolar disorder postpartum onset. The standard of care required defendants to recognize that Lindsay's severe adverse reaction to Zoloft, characterized by activation, worsening insomnia, and racing thoughts, was a red flag for bipolar disorder. The standard of care further required that after a second antidepressant, Prozac, caused similar activation, the defendant should have diagnosed bipolar disorder and prescribed a mood stabilizer rather than continuing to try antidepressants. This is really sad. This is so sad. The standard of care required defendants to conduct appropriate testing, including blood plasma levels of medication, to determine why Lindsay was having adverse reactions to relatively low doses of medication and whether she was a slow metabolizer. Thank you, Karusha, for the follow. I appreciate it. The standard of care required defendants to follow the start low and go slow principle when prescribing medications, particularly given Lindsay's demonstrated sensitivity to psychotropic medications. Instead, defendants added and accelerated medications in an ad hoc manner that radically increased the risks to Lindsay. The standard of care required defendants to inquire into the content of Lindsay's intrusive thoughts, which were actually auditory hallucinations. Had they done so, they would have recognized the psychotic nature of her symptoms and the danger she posed to herself and her children, including the danger of postpartum psychosis. The standard of care required defendants to coordinate care among themselves and with other treating providers. Instead, the providers failed to communicate with one another, and Nurse Gelada did not even return women and infants called to discuss Lindsay's care. So they all knew about each other, they just didn't communicate. It's not like she was hopping around and not telling them about each other. Interesting. The standard of care required defendants to seek collateral information from Lindsay's family members, who would have provided crucial information about the severity of her condition and her functioning at home. The standard of care required defendants to recognize that Lindsay, as a patient suffering from severe postpartum mental health disorders with suicidal ideation, posed a risk of harming not only herself, but also her children. The standard of care required Dr. Goodhart and McLean Hospital to provide adequate inpatient care during Lindsay's brief admission, properly evaluate her condition, and ensure appropriate discharge planning rather than discharging her after 5 days with limited insight, judgment, and suicidal ideations back to the same providers who had been providing inadequate care. The standard of care required Dr. Diaz and women and infants to properly evaluate Lindsay, obtain an adequate psychiatric history, including inquiry into her early postpartum period, and recognize the signs of bipolar disorder rather than dismissing her severe depression scores and recommending medication changes without proper follow-up. Defendants knew or should have known that Lindsay presented a real, clear, and present danger of harm to herself and her young children. Defendants' collective failures to comply with the standard of care more likely than not, directly and proximately caused the injury suffered by Lindsay, including Lindsay's killing her children and her attempt to kill herself. Wow. All defendants owed Lindsay a duty to exercise reasonable skill and attention in their care and treatment of her psychiatric condition. Defendants failed to exercise reasonable skill and attention in caring for Lindsay, and their conduct deviated from accepted standards of medical practice as set forth above. As a direct and proximate result of the negligence of defendants, Lindsay suffered severe personal injury, including but not limited to the loss of her 3 children, Cora, Dawson, and Callan. Stacy, thank you for the follow. The development of severe postpartum psychosis with command auditory hallucinations, a thoracic spinal cord injury resulting in permanent paralysis below the sternum, multiple closed fractures of the cervical and thoracic vertebrae, multiple rib fractures, neurogenic bowel and bladder dysfunction, impaired mobility requiring the use of a wheelchair, severe psychological trauma. Further, the acts and omissions of defendants constituted gross negligence and a reckless indifference to the health, safety, and welfare of Lindsay and showed reckless disregard for the consequences which defendants knew or should have known could result from their actions or omissions. I agree with that. They should have known that a lack of proper care, what was going to happen. I don't know. And these are just the different let me see what she's asking for. Award plaintiff damages, including punitive damages, is allowed by law for the personal injury suffered by Lindsay Clancy, including her physical injury, psychological trauma, loss of consortium with children and her spouse, and all other damages permitted by law, plus interest as allowed by law from the date of this complaint, plus cost and attorney fees, and grant such other and further relief as this court deems just and appropriate. The end. So what do we think? Is anybody there? I still got people here? Y'all are just listening to me read. So what do we think about that, guys? Yeah, it is sad. It is heartbreaking. Yeah, it's really important to have a doctor that listens to you. It really is. And if you know, I don't think, having listened to everything and they have notes on what the response was and what these doctors were putting in their notes, there's nothing left that she could have done, guys. There's nothing. What else could she have done? Like, you know what I mean? I didn't realize I'm filming myself. There's nothing left that she could have done. Like, somebody tell me what else they were expecting from this woman. She did everything that she could to get help. She told them how she was feeling. She told them what was happening. They knew how this could end and still didn't fix it. They knew how serious these symptoms were. And yet, nobody said, wait, let's stop. She's not getting better. We're concerned because we know how this can escalate. And nobody did anything. And then it escalated, and now, people are trying to make sense of what she did. You can't, I don't know. Her and her husband both begged for help, along with the mother-in-law, who also reached out to people. I don't think docs always talk to each other. No, and they should. They should. But they definitely knew about each other. She was misdiagnosed, over-medicated. And you know what? Those are red flags. Those are things they should have picked up initially when her reaction was what it was. This is stuff that had anybody noticed in the beginning, this could have not escalated. The system failed her and her family. Yeah. Yeah, it did. It's really sad. I'm a certified English teacher, and this case makes me think of the short story, The Yellow Wallpaper. Oh, I never read that. I got to read that, Holly. You can ruin someone's career with a diagnosis. Yeah. You can ruin someone's life with a diagnosis. This hits me hard because you said my mom was like her. I was given to family to take care of me. Oh, Kazoo, I'm sorry. Yeah, for anybody, I feel like anybody who's experienced any kind of something after giving birth, and not even just giving birth, just at any point in time. You don't even have to be a mother, right? People they have things that happen. You know, it's really scary. The first 6 months of your life, the pharmacy should have questioned the meds, the different doctors. Now, while I say that, I agree, Louisiana Mama. I don't know that she went to the same pharmacy, or, you know what I mean? Like, so I don't want to pin it right on the pharmacist automatically. However, yeah, all of that should have been a red flag. You know what I mean? The pharmacist also gets the diagnosis, like, and again, they're not medical doctors treating her. However, like, you have knowledge of these medications and the side effects. So yeah, there should have been concern there as well, in my opinion. Where did you get these documents? So Jamie, how's our page coming?
What page?
You know, the page, the drop page you were supposed to make.
What? Wait a minute. When was that?
Last night, like,
You didn't tell me I had to make a page.
well, I didn't tell you, but like, you should. I was thinking it, and you should have known. Someone just said, where can we get a hold of these? It was last night, Jamie. Yeah, you don't remember?
You didn't tell me to make a page.
Well, I would never tell you to do anything.
I never asked me. Or whatever.
Jamie, sweet Jamie.
Wait a minute. Hold on. They're saying something. Hold on. Let's see what's going on here.
Oh, is this?
Oh, they're still saying the same thing. I'm waiting to see if the judge is going to make a.
Is this Georgia Burt Colt Gray that you're seeing? What are you watching?
For this trial, what we're discussing.
Yeah, but what are you watching it on?
Oh, Court TV. Sorry.
But they're live right now with Georgia Burt Colt Gray, right?
No.
You're on Court TV.
They're repeating what they were saying yesterday. I don't know if they're going to talk about if the judge made a decision or not.
You're on the TV.
Yes.
I'm on Court TV on YouTube. Gotcha. Makes sense why I wasn't finding it.
Very briefly, I don't even have to mention their names, but Duxbury Fire Department paramedic.
Yeah, this is a tough case.
Yeah, it is. It really is. And for those of you who are asking about these documents, sweet Jamie, if you could help me make a page today where we can just on maybe FB, I don't know, wherever you think it would be better to have this page. Like maybe we can like start like a group like case files page where we can just post all of for different cases, all of the paperwork. This way, if anybody wants to go and look at them, they have access to the same things we have access to. Everything but crazy. Thank you for the file.
Okay, so what would you like it to be called?
So
people can
everybody in the chat, what do we want the page to be called?
Another fire.
Anybody?
Or do you want to? Well, actually, you can make it. I mean, do you have just a personal page there, or do you have?
No, I have. Well, I have a personal page, but I also have Ivy Rose Nose page.
Okay, so you can make it right under that.
Can
and
I
it
can
be-
put it in Ivy Rose Knows?
Yes, and then you can have links at the top of your page to all this information.
Oh.
Keep carrying.
Yeah, so we'll do that. Ivy Rose, yeah, we'll do like nose facts files, like no file facts. And you can help me get them up there.
All right.
I just don't know how to do that with the link or anything like that, but yeah.
I'd have to go on and look because I never actually made one myself, but I'm sure I can figure it out.
Yeah. Yeah, we could try. Yeah, I'll work on that today. Anybody else who knows how to do that, I welcome anybody's expertise because, well, I'm not the person.
All right, so the defense is arguing to limit first responders' testimony.
Why are we limiting everybody's testimony? We're limiting people talking about having had experiences with postpartum, psychosis. Why are we doing all this?
Well, this is her defense attorney what is arguing. He wants to limit it. I don't know why.
I feel like, I wonder why.
I don't know. I know that they were claiming that every responder that came out of there was bawling their eyes out. I know that much.
I see. I could see that.
I don't know if he.
But I mean,
I don't know what he's thinking.
yeah. Holly, if you know how to do that, that's a good idea. We can make it a Google Drive link.
Oh yeah. I don't know. I've never made a Google Drive link.
Me neither. That's a Sam thing.
Yeah, that's
I
the
feel
same
like,
thing.
yeah,
I
I feel
can
like
look on FB and figure out how to make a link up there to put all this in.
Mm-hmm. So we're talking and following the Lindsay Clancy trial. Sam said she can.
We're trying to inflame the passions of the jury.
He thinks it's going to inflame the passions of the jury if the first responders testify. I don't know.
I feel like if they tell how horrible the scene is that they saw, it just, to me, I feel like people are just like, it makes it harder to believe that somebody in their right mind would do something like that. You know?
Yeah.
If you talk about something being cumulative, don't I have to hear what the first witness says first? And then ask the Commonwealth is an offer of proof. Is anything different that this saw or did or is going to bring to the jury? And again, what I'm saying, it's difficult for me since now to tell the Commonwealth you can't call witness number 2 without knowing what witness number 1 is going to say.
Yeah, he's having a hard time of, he hasn't decided yet. It looks like he's going to say that, you got to have that testimony.
Let me see if I can pull it up on my TV. Anybody else have kids and none of their remotes have a back?
Would you say have a TV and what?
My kids, all of the remotes in my house, for
Yeah.
some reason, none of them have backs. Like where the batteries go.
They're taking the batteries.
They're taking the batteries, and I'll at least put the backing back on if you're going to steal my batteries. But none of the remotes in my house have a back, and it's one of those things like not putting the toilet paper on the roll. Like I can flip the hell out for not having a back on my remote. Drives me nuts.
I think you need to go shopping for batteries.
Yeah.
That the actions of the defendant were the cause of the death. Here, unfortunately,
Not they put the dead batteries back in my remote and took the good ones. Damn.
that's a point of the fire. But you also have Lindsay was devastated on finding his children in the manner that he found them. That he was.
Yeah, the prosecutor's saying you got to hear everybody's, from her husbands to responders.
Yeah, I agree.
Anybody would have saw something different, maybe.
They thought they were responding to one victim, the defendant.
That's smart, Jamie. An air tag on the remotes. I found mine in the refrigerator once. And on the trampoline.
What's going on?
On the trampoline.
Because my kids fight with each other over the remotes. And so my daughter, when we went to the water park the other day, I was putting our stuff back to leave, and I'm like, why do you have a remote in your pocket of your shorts? She was like, because I didn't want them to get it first when we get home. I'm like, there's 12 TVs.
Oh my God.
There are 12 TVs. Why are you walking around with a remote in your pocket?
Oh my God, thinking way ahead, I guess.
Right? Like, you got your tablet. Watch it on your tablet. It's weird.
It is not the Commonwealth putting on a circus or parade. It's the Commonwealth.
Amy said, I'll be going to the courthouse Monday morning for opening statements. Amy, really? Really, really, really?
Yeah, I'm right next door. It's like a 45-minute drive from me.
Jamie, I will buy you lunch. I will pay for your gas. I'll get you a driver if you prefer. I mean,
Oh my God.
it's not like you're like, I don't know, like, I mean, it's just a Monday. What are you doing Monday?
I don't know.
I know. I feel like I know what Jamie's doing Monday.
I don't know. I'd have to look and make sure I don't have any doctor's appointments.
Doesn't bring anything extra afterwards.
Just Zoom them. That seems to be the thing nowadays. I'm just kidding.
Oh, my doctors don't do that.
I'm just kidding.
Trust me, I at least have 1 or 2 appointments a week. I'm not sure if I have one on Monday or not. How can I check while I'm on here?
I don't know, but I feel a reschedule coming on. Tell him you got court. You can't reschedule. We ain't lying. Lakota said she's just kidding. I'm not. I don't know if I'm kidding that much. Sam just said Sam's Club got a good prices on a bunch of batteries. I probably have a bag of batteries in my house. They just move it, and I don't know what they do with it when they're done with it.
Amy said she's going. Is she,
Yeah.
is she serious?
Amy, are you really going?
Are you serious or?
Sam said peer pressure, Jamie, peer pressure. Oh, you really are going. Oh, are you going to be like talking about it and going live from there? Like, obviously you can't be in there with your phone. Like, I understand that, but like, yeah, take notes. Take lots of notes.
Yeah, trust me, Massachusetts doesn't fool around with a lot of things. You go 1 mile over the speed limit and they got you, but I mean, they don't play around.
Yeah, I would love it if you could take notes. I would love to hear. Are you going live? Like, I would love to hear.
Because I was, when I
You
was
don't
going
know.
through my cancer treatments, and I was up at Women and Infants Hospital. I thought it was a very good hospital. I mean, they had me up there less than 24 hours later, and I had all my lady parts removed. But I mean, they took such good care of me. I don't know about this other part of the hospital that she went to.
You know, honestly, these hospitals actually, they're great hospitals. But again, not every doctor in a great hospital is good. You know? Just going for opening statements? Oh, that's so interesting.
I mean, from the area from where I'm at to that state, which is right next door, and I mean, that's like one of the top to go to for women.
Yeah. Like, I'm definitely curious to hear about the things we're not going to hear from where we are. You know what I mean?
Yeah, yeah.
I think that's super interesting. Lakota, I've been invested with this. I feel like there's such, I mean, in the recent years, there's such a big deal made about postpartum depression and how super important it is to get help if you have these feelings and what it can lead to. And, you know, people are always here and we're always saying get help. And then when these people are trying to, but something happens, you know, it's like, man, like,
yeah,
we don't, it's almost like we just don't want to recognize it.
Opening statements. Will you come live afterwards with us?
Yeah.
So you know how it's done.
I'm going to be the crime, essentially, until we get going on the trial. And if there
She
is
said, no, I don't do live. That's okay. That's okay.
Or you can tell me and I'll go live and tell it. I don't care how we do it.
Jamie said. That's so funny. Jamie's like, just, you could tell me.
Just write a little letter to me and
man, I mean, well, we're going to be able to watch it, right? It'll be televised.
Oh, yes, yes.
But there's going to be a lot of conversation that people in there are going to hear that we're not going to hear. A lot of facial expressions, a lot of things we're going to miss. Like, yeah, take notes. How long can it take me to get up there? Where in Massachusetts is this? Is it like near Boston? Ooh, I hate Boston. I'm a New Yorker.
Yeah, I think it is.
How long?
Because the hospital is in Providence, so
South of Boston?
It's got to be a little bit.
What do you think?
I mean, the hospital she went to is in Providence, Rhode Island.
It would take me 7 hours to get up there.
Oh, Plymouth. Why am I thinking Providence? Because she was at the hospital. That's why. Okay, so it's going to be farther for me. How much farther? I don't know. Plymouth it would be.
Sam said we will put it in we'll put it in a Google Drive and she will post it. Yep, we'll post it. And we can all post it on our pages. Like, I don't want anyone to feel like it's just on my page. We can all make sure that we have a link to it. So people can get it if they can't find one of us.
She is upset about what took place in the death of the children, as well as remember his pictures. Like, we mentioned before, the grand jury.
Yeah, I don't know. See, I understand the pictures part. I mean, I don't know how she could sit there and watch that.
Potentially have.
Especially because.
I agree that they should just show it to the jury, but she doesn't have to see them again, or the public doesn't need to see them. I mean, I understand that part.
Yeah, Jamie K said, "Pick me up in Philly and we'll go."
Oh, God.
That's so funny.
Sitting there and coming face to face.
Yeah, they're talking about whether they'll allow her to leave the courtroom if they do decide to play that.
I feel like, listen, this woman is traumatized enough. She's not saying she didn't do it. No, she knows what she did. She's admitting what she did. Like, to make her relive that, you have to understand at some point, even if you don't believe she was in a psychosis, you have to understand she is psychologically delicate and obviously is grieving her children, right? Like, both can be this true at the same time. I feel like that, just looking at that, can cause her to go right back into some kind of state. Like,
Oh, yeah,
you shouldn't. That, I don't know how doctors are allowing that and being like,
I mean,
hold on, I didn't recommend this.
I mean, yesterday, she had a few tears come out of her eyes, but I mean, just them talking about it. So I can just imagine.
And I can imagine how medicated she is right now, just to be able to sit there. Like, she looks medicated. She's very flat.
Of course, she's very numb. Very.
Yeah.
You could tell. Yeah.
I'm not gonna lie. If I don't know that I can. I'd swallow the staples. I couldn't live with myself knowing I did that. Like, I rolled myself right down the stairs in a wheelchair. Like, I couldn't live another day knowing I did what I did. I just couldn't live with myself.
I think she needs to be put in a psychiatric hospital, because I think if they release her, just having to live the rest of your life knowing what you did, wouldn't say that she wouldn't try to unalive
Well,
herself.
she's not up for release.
No, but I'm saying she can if she goes to a medical hospital. Once a year.
Oh yeah, they're up for yeah. But I don't see her. I mean, yeah, I definitely don't see them allowing her to be out anytime soon. I mean, again, look at Andrea Yates. It's been 20 years. She's in the psych hospital.
Yeah, they ask her once a year, and she says no. She doesn't want to leave.
Would you, knowing that at any given time the wrong proper medical treatment can make you do this to another person? I'd be terrified to be let loose in society.
Yeah.
Especially when you recognize what you did and it wasn't me, and I have no control over it. Knowing you have no control over it would make me not trust myself around people. I wouldn't want to leave either. I don't know. It's I definitely think that, I mean, as plain as the nose on my face, this is absolutely I mean, it's textbook, right? Like, what would she benefit if she planned this and just wanted to kill her kids? How was that a benefit to her? She was trying to kill herself too. She could have just killed herself,
I mean-
problem solved.
I mean, I think she was just thinking of herself at first, but then those last few days before it actually happened, that's when she had the thoughts of all right, she had to do the children too.
Yeah. Because she was told to. Because think about it, I could see if she was in and again, I don't want to say I understand it because I don't, but I could see if she was in a custody fight or something, and it's like, I'm taking the kids with me, you can't have them kind of thing. But there was no benefit for her to take those children out if she was just going to kill herself. Like, it doesn't make any sense if she just wanted to end it. Like, obviously, she took those kids too for a reason. Like, it's I just don't see a benefit. Why would she have done that without it being out of her control?
Patty, we're talking about the Clancy case, the woman that unalived her 3 children and tried to unalive herself in Massachusetts.
Yeah. And what she was repeating shows that too. Yeah, absolutely. Did Yates attempt on herself after or no? I can't remember. I don't believe she did.
No, she didn't.
She did not.
No.
She was hearing auditory hallucinations too, right? They were telling her to kill. She was just following the commands to kill the children. Was it a God? Why? It's always, I feel like it's always like a spiritual thing telling these people to do this stuff. It's really, it's really wild.
I couldn't imagine being in that position or being in that position. I don't know.
And I told you, I had a patient.
It would be so scary because if you can't control your thoughts and you can't control your actions, that's just scary. I couldn't imagine it.
I had a patient, I told you guys the story before. I had a patient who was schizophrenic, and he did it to his son. He killed his son, stabbed his wife in the process while she was trying to protect him. And then when he was finally leveled out on medications, realized what he did. He was just like, throw away the key. I don't want to be out. Like, he couldn't live with himself knowing what he did.
And like you said, it's scary with the doctors. See, I had a father-in-law that was bipolar. So after my mother-in-law had told me something, I just never allowed my daughter around him by herself. Because he would, my mother-in-law would tell me, she'd get up in the middle of the night just having this feeling, and he's sitting across the room with a GUN in his hand. So thank God nothing happened there, but he was in and out of the hospital, and then one time he just left because he didn't want to be there, and they can't hold you. So, but they didn't bother telling her or any of us that he had left. And then we found him in Florida, so thank God. But I mean, he was very manic. When he was manic, he was like all over the place. So it is scary.
Yeah. Yeah, it really is. My goodness. My heart breaks for this woman.
And that's another thing I don't understand now. Her mother-in-law and her mother and her husband all knew that she shouldn't be left alone. Why was she left alone?
Yeah. Yeah. I mean, they were there helping her. They were there, you know what I mean? But again, at what point does it not become a prison for everybody else in the family when you can't leave your house? Or, you know what I mean? Like, I kind of get where it's like only 20 minutes. I'm just going to run out. You know what I mean? To pick up dinner. Like, you need the mental break yourself. I'm sure it was a lot of psychological stress on him. Like, I kind of get it. Like,
Well,
even though
I
you shouldn't
understand
know.
all that. But I think when somebody stresses to you that they want to hurt their own children and themselves, I would be afraid to leave.
Yeah. But again, remember though, these voices were happening and she was feeling like this for months and never did anything until she did. You know what I mean? It's like,
maybe they just thought that she would get the help and they just didn't think that serious, thought it was that serious. I don't know.
oh. Yeah, I don't know.
I don't know, it's a tough situation.
It
really
is. And again, it doesn't boil down to whether she's guilty or not, right? We know she's guilty. She admits to the guilt of having done the crime. She
Right.
did it, right? The question is she criminally responsible? Did she have control? And let's be real, with everything we're seeing, I don't believe she did. Like she has no history of this. No, like until this happened, like you got to put everything into perspective and realize like she, it had to have been the mental illness.
Now, was I hearing you correctly earlier that her sister as well had
Yes.
postpartum issues?
Yep, postpartum anxiety and depression, yeah.
Oh, wow.
And again, that would have been a red flag to them because they said that she had no familial history. However, you didn't ask because she did.
Right.
And she had prior experiences herself. But again, that's the assessment that they didn't do, and that's 17 minutes.
Yeah, you can't. Yeah.
And family history with psych issues is a big deal. It's a big deal.
Well, yeah, I had a sister like that, but there was no history in the family, but she still is,
Yeah. And again, you're absolutely right. There doesn't have to be a family history, right? So even if the answer was no, the issues were still a red flag because at some point, you know what I mean? She had no previous history. Well, at some point, everyone's experience is the first time they experience it. You have to have a first at some point. And so just because she didn't have a history of it herself doesn't mean it couldn't be, because again, if you have a history of it, one of those issues were the first time. So it's like, make that make sense. Make that ideology make sense to me.
Exactly.
Brooke just said 17 minutes is crazy. My appointments are always 90 minutes. Yeah. 17. What are you doing in 17 minutes? I mean, let's be real. Before you get over that awkwardness, hi, how are you? No, I'm good. I'm feeling better. I don't know. You're really, what were you doing in 17 minutes?
Yeah, that's wild. That's just wild.
Yeah. Yeah, it is.
I don't know. I just got to say that I'm blessed. I have some good doctors because they've always spent anywhere from a half an hour to an hour with me.
Yeah, I have a great primary care doctor. I really like him, and he's one of those old-fashioned. He's older. He's one of those old-fashioned, like, he'll call me. I just want to check up on you. You know what I mean? Like he gives me his phone number and he's like, if you can ever not get through to me, calling the office, please feel free to text me. Like after I was in a car accident, he called me all the time. He saw me in the office and he wanted to see me like every day. And so he would Zoom call me just to check up because it wasn't necessary. You know what I mean? Like just to have those extra appointments, and didn't even like, it was no, like he wasn't charging insurance. He was just checking on me. Like, are you all right? Are you doing good? You have someone to help you with the kids? Like, is there anything that you need?
I mean, I have a doctor like that. I have his personal phone number.
Yeah.
This is how big he is. And I'm like, oh my God. Even if I don't think of calling him, he's calling me. Sometimes he would call me at, 11 o'clock at night.
Yeah.
To make sure he was okay.
Yeah.
And I still have him to this day. I love him.
Yeah.
I love him to death. I mean, yeah, I can't.
Do too.
Not many people get doctors like that.
No.
It's very rare. And the way I look at it, it's very rare.
Find yourself that doctor. My primary care would take care of my father too when he was alive, and he would stop by the house when my father got cancer, and you know what I mean. Like, and again, my primary care knows I'm a nurse, but if I ever had a question, like I can't give you anything clinical, but something's not right, he would be like, do you mind if I stop by? He would come by the house to check my dad for me because I'm like, I have nothing clinical to give you. Like, I don't know why I feel like something's up, and he was like, yeah, no, let me come by. And he would, no charge. The guy would just come by on his way home from the office and check on my dad. Like, you know what I mean? Like, it's so appreciative. And, that's the kind I want to be like, run my insurance to the hill, man, because you are so, like, he's a great doctor. I took all of my children to him when they were first born because I didn't trust anybody. I trusted this guy. And so he saw all of my children when they were first born until we got a pediatrician, and he's still, you know what I mean? That's how much I trusted him. I trusted him with my kids.
Yeah, mine, he don't care. If I describe something to him, I'm like, never mind. send me a picture. Like I said, I had his personal phone number, so, and, you know, he'd tell me if it looked serious enough, he'd tell me to go to the emergency room right away, and he would call them and tell them what to do, you know?
Yeah. See, my doctor would be like, don't even bother going to the emergency room. Like, you know what I mean? Like, he would be so honest with me. It's not even funny. You know what I mean? He's like, they're just going to tell you this, that, and the other thing. Let me see if I can call in a friend and get you in to see a specialist really soon. Like, he's that kind of guy that, and he treats, it's not just me, he treats like that. He treats everybody like that. You know, his kids work for his practice and the whole family is like that. Like, so just,
That's my doctor. I just got over here. Her mom works as the receptionist, and it's the first time I've been to the doctor. And I explained, like, this is what's wrong. I've tried this, this, and this, and she actually listened to what I was saying. And she's even said when my kids were sick because their doctor's 25 miles away, she's like, just bring them in here. I can do a routine check. I can prescribe them medications if needed, so you don't have to drive so far to their urgent care.
yeah.
And my kids' doctors, their pediatrician, they all see the same one, and he's great. With my middle son with autism, he's like, let me know when you need a bed. I'll write the prescription for insurance. If you need diapers through insurance, I'm going to write that because his wife's an occupational therapist, so he's really with it, with that too, which is nice to have.
That's good.
Yeah. They don't make doctors like, not every doctor is like that.
No, Facebook FB is lagged a little, and it won't load the chat all the time. So I got to figure out why. Or I need to use my kid's tablet and just be on FB modding with
Yeah.
the volume down because it's not loading the chat. So if you guys were over there and came over here, I wasn't trying to ignore you to answer questions. I didn't see them.
Yeah, that's how Brooke's over there. She said that's how my kid's pediatrician is. She's amazing, calls after hours when they are sick, trusts my intuition, and really loves my kids. That's another thing. A doctor should always trust your intuition. If you say to a doctor, I don't know what's wrong with me, something just doesn't feel right, that should be a red flag for them. They should run with that. You should, same thing with a pediatrician. And I tell them this to my kids all the time because my kids, they want to call mom, the nurse, right? Before they take their kids to the doctor. Mom, what do you think? I don't like to play doctor when it comes to kids. Again, that's not my specialty. But again, I have experience. And so my daughter called me the other day and she's like, Mom, so-and-so's got a really bad rash. And the doctor said it was hand, foot, and mouth. But, she works for a daycare and she's like, I don't know, something it doesn't seem right. He's not acting right. I'm like, when she said that to me, my first reaction as a nurse was take him to the doctor because you are saying something's not right. You know him better than anybody. You got to go figure out what's not right. And thankfully, she did. You know what I mean? And it wasn't what they thought it was.
Right.
But you know what I mean? Like a doctor should always take your intuition. Your body is telling you things. Your body is telling you when something's wrong. And it's up to you to pick it up. And that should be your body's always going to give you the clues. Always listen to yourself.
It's scary. Like the emergency room to me is scary. And you have to go through that first protocol first before they get you to where you need to be, right?
Yeah.
So I had this doctor in there once and I had called up my daughter and told her where I was. So she came right away. And the doctor wouldn't even look at me. He's talking to my daughter, pointing at me. He goes, you see this right here? This is anxiety. And I went off on that guy. And thank God there was a phone on the wall. So I knew my doctor's extension. So I called him up. I said, can you come down here quick, please? This guy's trying to send me home and I know something's wrong. And thank God, as soon as he came down, he goes, I'll take over this, he told the other doctor. And I said, I don't want to ever see that guy again. And nothing but less than half an hour later, I was admitted because I was going into septic shock again.
Oh, wow. Mm-mm.
And so I just couldn't stand that guy. And then I found out that they had fired him. And I'm like, oh, wow, too many complaints, I guess.
Yeah, it's a scary world out there. I worked in, listen, I'm not going to say where, but I worked as an orthopedic nurse. I charge the orthopedic surgical floor. And we had this one doctor. I used to get so mad because I complained to the hospital, the head of the hospital. I had meetings about him. This doctor would always have post-surgical infections. Like there was always his patients always came out of surgery with an infection.
Wow.
And I'm like, this is that not every patient should come out with an infection. Something's happening in that OR. And I would be talking to the nurses that worked with him, his scrub nurses, his scrub techs. And I'm like, what is happening? Why are all of his patients coming out with infections? To the point where I used to be like, I'd go to the medical doctor and be like, just put him on an antibiotic because you know it's a Dr. So-and-so. And when I would complain, the hospital's going through its where it gets its like awards and stuff like that. And
Right.
they weren't listening to me. And I was like, to the point where I'm like, I'm 5 seconds away from reporting because I really want to tell these patients don't see this doctor because you're going to come out. And again, orthopedics, when the hips, the knees, these are older people. Generally speaking, a lot of the patients on orthopedics are older people with the hip replacements, the knee replacements, like they're older and they can't fight off that infection. It hits them a lot harder. And I'm like, why are we not concerned? And so when I watched that doctor performing these surgeries, I was so like, that's when I really didn't trust doctors or surgeons because I'm like, these people that are trusting this guy don't know that he's not washing his hands correctly, or he's taking his gloves off, or he's not keeping something sterile. He's doing something in that OR that's not, correct, and it's causing infections. Till he was fired.
Well, a lot of nurses are afraid to say something. I knew this going through, my septic shock and then going through my cancer. They're afraid, I heard them talking about this doctor and, they'd be whispering, but I still could hear what they were saying. So they used to have to put me in a separate room because I don't have a spleen as well. So I had to be away from the other people.
Oh, wow.
So two of them came in and I said, all right, you guys, tell me what the truth. Tell me what's going on. I want to see if they would tell me. She goes, please don't say nothing, but I'm going to tell you this, this, and this. And I'm like, oh my God. See, they're afraid to say something because they don't want to lose their job because they're talking about this doctor. Even though they know this doctor is doing something wrong, which I found kind of strange.
Yeah. No, always trust yourself. Always ask questions. They're not all the most knowledgeable or the best. So advocate for yourself always. I don't care if people think you're crazy. I don't care if people think you're, you know what I mean? Like, what's wrong with you? Like, trust me, when it comes down to it, you're going to be glad you did.
Yeah, and you know your own body, so yes.
So I just want to show this. I'm going to, hold on, let me put it over here. Just to give a little insight on what postpartum psychosis is. Just a quick Google search so you guys get a good idea of what it. Here, let me turn this around. Can you guys see that? And I'll read it too, so in case you guys can't see it. But it says here, it says warning signs. Postpartum psychosis is rare, but severe psychiatric emergency that onsets suddenly, usually within days or weeks of childbirth. Symptoms include hallucinations, delusions, extreme confusion, paranoia, and rapid mood swings. Because it represents a complete loss of touch with reality, it requires immediate hospitalization and medical intervention. Unlike the mild transient baby blues or typical postpartum depression, postpartum psychosis is characterized by a rapid, dangerous deterioration in mental state. Early pink flags and primary symptoms include hallucinations, seeing, hearing, or smelling things that are not there, delusions, fixed, false, or irrational beliefs. For an example, believing a baby is possessed or especially threatened. Going days without sleep without feeling tired. Rapid shifts in conversation, erratic behavior, or disorientation. hyperactivity, racing thoughts, and pressured speech. Postpartum psychosis typically has a strong biological and genetic basis. It's heavily linked to a personal or family history of bipolar disorder or a prior episode of postpartum psychosis. Shifts in hormones, sleep deprivation, severe psychological stress following childbirth are thought to trigger the condition. And these are places that they tell you that you can get help if you need it. But I just feel like that's you know what I mean? Just a quick run over. That's exactly what you described. So, yeah, I feel like it's textbook in this case. It's really sad. And now she's got to relive it through a trial. Wild. Absolutely wild to me. She did try really hard, louder than bombs, to get help. She tried really hard. So
She did everything she was supposed to.
there's nothing
Yeah.
left that she couldn't.
I'm shocked that her doctors, after being in the mental hospital, didn't have a care plan where they talked with each other about medications and going forward on what to do.
I didn't see anywhere it's talk about a safety plan. If you feel like this is what you do. You know what I mean? I don't know. I feel like a lot was skipped there. And I don't understand why the prosecutor wants to try and act like she did this on purpose when, I mean, literally it left a trail right to the diagnosis. I get that, you know, you want people to be responsible, but they have to be responsible. And I don't know that I can say that she's criminally responsible. No, she's physically responsible for doing it, but criminally, I don't think she had control. I don't think it was, you know, and again, she had an underlying disorder, you know, which was exacerbated by all of this, the postpartum period, all of it. Man, it's crazy. Hey, she shed. So
She has stuff at work on her TV watching.
Oh, that's so funny. I mean, it's wild. I don't know. I'm curious. Wait, what's today? Today's Friday. Man, I gotta go through the whole weekend without court.
Yes, you do.
That's so stupid. I have no
We all have
patience
to
for
wait.
stuff. I have no patience for stuff. Is that a psychological disorder? Because it's me. I have no patience. I need it done now. I need to know now. Like, can we just hurry up? I need to know what's gonna happen.
That's me. I want to know it all right
Yeah.
away. You know,
Like, come on, man. Like, I gotta sit and like, I don't know. But it's gonna be Pat first. Do we know who's being called second?
no, I
We-
didn't hear anything yet on that.
We don't know the lineup.
No.
Man, these poor kids. You know, and then I don't want anyone to take away from the victims, the children, right?
Yeah, that's the hardest part.
Yeah.
Right there.
Like the last thing they saw was their mother killing them. But it wasn't even their mom. You know what I mean? It's like, man, I don't know. This is wildly emotional.
Yeah, they were probably just way too young to understand why their mother was doing what she was doing.
Yeah. And you know, let me ask you guys this. I was thinking about this last night, okay? Journals and diaries, should they be able to be brought in as evidence? What do you guys think?
Yes.
Really?
Yes. It gives you more insight, I think, on the person itself. You know what I mean? Maybe things that they weren't even telling other people, or whatever the situation may be. I mean,
I disagree.
why?
Because that is your personal place to put your thoughts. I don't think that it's like somebody saying it's okay to read her mind because I want to know how she was thinking, right? Like that's an invasion of my privacy. I'm a person, I'm human, and I have a certain degree of privacy. And I feel like unless she offers it up, that was her own, that's her diary. That's where she thinks. And I feel like diaries and journals should not be relevant unless one, the person is deceased, and it's to bring because we don't know, or they offer it, but I don't think that you should be able to take somebody's journal or diary as evidence. I agree, PJ Shelley, that it would show her mindset. However, if she doesn't offer it, that's an invasion of her personal privacy, and I don't feel like that's okay. I don't think the government should have the ability to take someone's journal where they keep, we protect medical information.
Well, I think, well, yeah, but I think if you look back in history, in a lot of cases that they used people's journals and stuff like that, like they would detail the crime that they did. It helped out the case. I mean, knowing, I think it tells a lot.
I agree. It helps. And of course it tells a lot, right? Because you're telling things you're writing things down that you wouldn't otherwise say. But I think that you have a right to privacy to some extent. I feel like just like your spouse can't talk about what you tell them in private, what you tell yourself in private, you shouldn't be able to testify about either.
Well, how do I put this? Like, say if it was you, and say, let's just hypothetically say, sister viewers, and something happened, or she did something, or something happened where you wanted to know more, but you couldn't find out more because if there was a law saying that you couldn't look at any of that, you would never know.
Right. But I mean, and Jamie Kay just said it, and it's kind of like a therapist, right? You're not allowed to access those records. They have a right to privacy.
Now, did she know that her husband read them?
I don't know. However, if you do let somebody read them, then I think that it's fair game at that point, right? But if it's something you keep truly personal, I think that that should be personal. I think, and people are saying, yeah, but it's a crime in court. However, there are innocent people that are charged with crimes and they really didn't do anything. And I think that there's got to be a certain level of, it's a human right, you know what I mean, to think. And if we want to write our thoughts down and not share them with anybody, I think we should have that right to do so. I don't think that the government or police should be able to walk in and be like, you know what, your own private thoughts, I'm going to take that from you. Nobody was interested in her journals when she was sitting there saying she was hearing voices. Doctors can sit there and be like, can I read your journals? Let me see what you're saying. Nobody was interested in it then.
Well, her husband was, but he just, I don't know what he was trying to do about it after he read it. I don't know. And I don't know if she knew that he read it, but he did say it. He read her journal.
Yeah, I just feel like journals, I feel like are just private. It's your thoughts. And I feel like it would be the same thing as being like, can I read your mind? Let me hear what you're thinking.
She journaled because she didn't trust her own mind.
She
was documenting her medications, her day-to-day life, and all that stuff.
Yeah. And I know a lot of people with these diagnoses similar to that, they do journal. Brooke just said she's looking at her journal now. A lot for some reason, and it might be to try and, like, if you see your thoughts, maybe you can make sense of them. It might be a thing where they work it out, and I do know some people say that psychiatrists tell you to keep a journal, and that they do. However, I feel like sometimes it's just writing it down and maybe seeing something can put it in a better perspective for you. And I feel like, I don't allow you to just, hook me up and put a switch in my head and say, I'm going to read your mind. And I feel like a journal is your thoughts. I think that's an invasion of your thoughts.
I could see that in some cases, I think.
But I will say this, if you allow somebody else to read your thoughts, then it's fair game. Like if she allowed her husband to read it, then I think that, that everybody gets to read it because it wasn't that safe to you. Like it wasn't that protected to you. However, if it's something that nobody's ever read and you just keep it to yourself, I think there should be a limit there. You know?
Like say, even if you were like planning a murder and you were documenting in your diary about it.
Well, yes, because that's your thoughts, right? Like, I mean, because then we could just put a chip in everyone's brain and be like, I'm just going to read it. Up, this one's thinking about murder. It's the same thing. It's your thoughts.
Well, I'm
It's
thinking
just
about
putting your
it.
thoughts on
There
paper.
have been cases where journals have helped them convict someone because they had it all in the journal.
I agree with that. And they do help, right? They would help, and so would reading someone's mind or having access to someone's thoughts. Then there would be no problem, right? Like we just know what happened. And so, yeah, I feel like unless it's handed over, it should be. Well, that's not true. Once you write it down, it's still your thoughts, right? And some people need that to put it into perspective or just to keep it as a memory. And I just feel like there's certain things that shouldn't be. You should be able to have a right of privacy as a human. And I think that's
I think it would have to go like case by case,
Yes.
depending on what the issue is.
right. I agree. Once you let somebody else read it, I think it's fair game because then you didn't hold it to such a high level of privacy, right? Yeah. But and the only way to have true privacy is to not write it down. But now take somebody who may
Right.
have a hard time organizing their thoughts. You know what I mean? And sometimes they need that just to organize it. And so, I don't know. I just feel like that's your thoughts.
Well, Sarah, I understand that. Once you write it down, it's not your thoughts anymore, I think, and you risk that being subpoenaed.
Right. But it shouldn't be because why would it not be your thoughts? You're just putting them on paper, but it's still your thoughts.
Right.
You
Or
know?
maybe she wants the journal released because it goes to her state of mind. Defense. Oh, that's good. Yeah.
That's another thing. Like journals can be taken out of context, right? Like, what if you're so angry and it just helps you to write down the things you would do, but you didn't really do them? Or, you're sitting there, you just, ever tell somebody off and you say things that are totally unhinged, that's not out of your character. But sometimes it just helps to vent. You know what I mean?
Yeah.
Like, and then all of a sudden something happens years later and you're going to go get my diary from when I was 20 and be like, look, see, she had a history of things. No, I was venting. It could be a vent. Like you can take it out of context.
I
My
think the
thoughts.
court would have to take that as a thought, not as something,
But then how can someone interpret my thoughts other than me? So I feel like journal, like diaries should be, I don't know. I think they need to be handled with care. You know what I mean?
Yeah, I would say it would be a case by case or whatever
Yeah.
the situation may be when it comes to that.
And again, if you let somebody else read them, then that gets thrown out because they weren't so private to you that you let somebody else in your head. But if you didn't,
Yeah, I think at this point, that's what I want to know. I want to know if she knew her husband was reading them.
I don't know. But if he was reading them and whether she knew or not, and she did, why did you not hand them over? But I feel like
that's what
you can hand them over, but everything she was saying all this stuff out loud to them.
Right.
So, I mean, they didn't take the red flag when she was saying it.
But he didn't, it didn't seem like, I don't know, that would be something very urgent for me. Like say my daughter,
But
say I read her journal and she was saying stuff like that, that would be very urgent to me.
Yeah. Always, Manda, thank you for the follow. But she was saying it to him and he was calling them saying, this is what she's saying. And they didn't do anything about it. So I don't think that she could have taken pages and they would have changed their mind. She said it and he called them on his own and said, this is what she's saying. This is what's happening. And they still didn't take it seriously enough.
That's just sad. I mean, somebody saying something like that, that's not urgent to them. I mean, to the doctors, the nurses, whoever she was contacting. I mean, what? I mean, yeah, they definitely failed her in that sense. Very much so.
Yeah. I just feel like, what else could she have done? She called hotlines. She admitted herself, put herself in programs, kept going to the ER, was telling doctors everything. What else does the prosecution, what else could she have done?
I think we're gonna have to wait and see because, I mean, did they advise her not to leave? Because she's the one who said she wanted to be there for her daughter's birthday party. So did they advise her not to leave, or she
No.
just left anyway, or?
No, they discharged her.
Yeah, but I'm wondering if they discharged her because she was gonna leave anyway.
Well,
They still have to discharge you, but I mean, I don't know if they advised her, hey, maybe you shouldn't leave.
so they can't discharge you unless they discharge. They have to take that responsibility. So she can leave without against medical advice, right?
Yeah.
And she can do that, but that's technically, while they'll discharge you out of the system, that won't be an actual discharge. That is patient left against my
Right.
advice.
Yeah.
That wasn't happened. They discharged. And you don't just say to a doctor, can you send me home? And they're like, well, you shouldn't go home, but yeah, since you want to go home, that's a responsibility on the doctor to discharge or not, regardless of what the patient wants.
Yeah, my mother did that a lot when she was in the nursing home. I mean, she'd take herself right out of there and they'd call me up. We can't hold her, but she's leaving. I mean, so at least they alerted me so I could get her back to where she needed to be. But I mean, yeah, I mean, they'll tell you they'll advise you not to, and if you're determined to do it, you're going to do it. But at least they call a family member or something. But
yeah, but they won't actually discharge you just because you're saying I'm going to leave anyway, because then they hold the responsibility if they discharge you when something happens.
Right. I mean, they can't force you. They'll say, "Hey, I can't." They told me many times, "We can't force her to stay."
Mm-hmm.
Like, okay, we'll fix this. And it's a tough situation to be in because you don't know where to turn. Because I couldn't make my own mother. I mean, it took things happening to how she got back in, but I mean, she's just stubborn.
Yeah. And right, if she is a danger to herself or others, she can legally be kept there. Absolutely. And they literally hold court right there in the hospitals. However, she did say before that she was feeling better that day. She felt better. And she felt better when she got home, and she had a couple of good days and then it came back. So in all fairness. But again, what was the change in treatment? Like what was I don't know. And again, a holiday weekend, a skeleton crew, which really does happen. Not much is happening on a holiday in a hospital. I mean, so many times during holidays, I would, like on these, I'm sitting there like, okay, well, there's really nobody here. I'm literally running 2 floors and I'm the best you got. You know what I mean? Because there's nobody else. You got the couple doctors in the ER. You got a couple that will respond to emergencies that are floating around the hospital, but I mean, you don't have much happening.
And yeah, that's a tough situation for a hospital because I mean, I was in the hospital once when they were having a nurses strike. So I mean, the ones wherever they got them from other states or something to come in, I mean, you had one nurse for one whole floor. And the poor things will run, but you got people, screaming in pain and everything else, and that's all you hear all night. I'll never forget that. I'll never forget it. But I mean, yeah, it's tough.
Yeah. Brooke just said, I never realized how truly disconnected I was until I'm looking back now. She's reading her journal that she kept when she was going through that situation. I kept track of what was happening, but distanced myself from my writing. How that's super interesting to be able to look back and see the thought process and how different it was from. That's really interesting.
So Brooke, well, how do you think about that now, looking back on it?
So Brooke, she said, what do you think about that now, looking back on it? Wow, how truly disconnected she was. That's wild. I love the insight, the perspective from somebody who's gone through that. It's, because because it's such a hard thing to explain or to understand if you didn't experience it.
Right.
You know, if you never touched hot and you don't know what heat is, how do you explain what heat is? It's warm. What's warm? I don't know what heat is. You know what I mean? How do you explain something that not everybody has experienced and make them understand it? You know, I've never seen the color pink. Well, it's kind of like red and white mixed together. Well, I don't see colors, so what color is red and white? You know? So Lucid Dreams just said, my dad didn't write anything down. He sketched everything. See, in his brain, he interpreted things in images. That's pretty, wow. Do you think
Yeah.
this case will be an example to doctors to carefully look at files? They, when I
Also-
tell you, it is jammed down the throats of nurses, doctors, and medical staff. When I tell you they jam this stuff down your throat, you're constantly you have to keep up on your education. You constantly go into these. I don't understand how they all let this fly like this.
Yeah, that's too many people that she went through that it just failed.
And that's why you don't see too much of this happening, is because there's so many things to set in place to catch it. How did it run through like this? It's really just one of those things that just spiraled out of control and just went, nobody picked it up. Like the backup people, the secondary people that she was seeing should have picked something up. Like Brooke said, I feel like a terrible mom, honestly. There was no emotion towards my kids and the fight for their lives. I knew I loved them beyond words, but I didn't or couldn't express that. Wow. Wow. That's super interesting.
Yeah.
There was no emotion as her kids were fighting for their lives, and she knew she loved them, but there was no expression of love. Like that's I can't even imagine that feeling. Like I know I'm supposed to be here with them. I know I'm supposed to want them to live, and I do want them to live, but like there's just no emotion at that point in time towards that situation. And let's be real, a lot of times it's emotion that keeps us going in those situations, right? So when you don't have any, it's really hard to just get through these situations with no emotion runs us sometimes.
I mean, and especially with a family member. I mean, it's hard, especially when you see, a doctor has put them on the medications, and I see what that medication has done. Like it makes them so numb, like they can't have any feelings or emotions, or it's just strange. I don't know. I don't know if there's a better way out there or what is. And like my father-in-law, he just didn't like taking the medication. He would go on and off it constantly because he didn't like how he felt.
Yeah.
He knew that he felt numb, and he knew like he couldn't, like he loved his granddaughter, but he didn't know how to love her. If I'm explaining that right.
Yeah, that makes sense. Wow. I think it's just, it's really hard when you don't understand it or haven't experienced a loved one going through it or yourself to even, to even understand it. Like, if how many people have watched their family members do something or go through something where you're like, it wasn't them. Like that wasn't
Right.
their right mind. Like I know, I understand that, but to the rest of us, it's like, well, look what he did.
Right.
It's like, but it's such a hard thing. You got to find a way to get 12 people to understand something they could never understand.
And especially if they hear that, they know that they're on medication, and if they hear people whispering or talking about them or something, saying, well, it doesn't seem like the same person I knew. So in their head, they're like, all right, I'm not taking this medicine. And then there they are off on another tangent because they're not on their medication, and they just want to feel normal again. That's all. They just want to feel normal again.
Yep. I wonder if any one of those jurors, like, have you ever suffered postpartum depression? Have you ever suffered a psychosis? Do you have any underlying psychological? I wonder if how many people on that jury, you might have someone who suffered a psychosis or a postpartum depression and has an understanding. I'm really curious as what questions they asked And I don't
Yeah,
know
I
that.
find it interesting that they have 12 women and what, 6 men?
Yeah, but that can go both ways, I feel like, because I feel like as mothers, how many of us don't want to give her the, oh, she knew what she was doing and it was just cruel because we're angry because we as mothers would never do that. It can go both ways with a woman.
Well, yeah, but they're told that in order for them to be picked, that they have to be able to be open and, they ask that question with, do you think you can be open-minded to this?
Yeah. Do you think you'd be able to sit on the jury and be open-minded?
I think I could, yeah.
Hmm.
And you ever see a lot of cases where, there's jurors and then there's a lot of things they didn't find out until after the case was over, like it wasn't allowed in.
Yes, I hate
And
that.
they say that they would have voted differently if they knew that information.
That I don't feel like a judge should be like, you know what, we're going to take this out. No, we're not going to let them see that evidence. If it's evidence, it's evidence. I don't
understand
think that you should be able, because then you're navigating it for them. It's biased at that point,
Yeah,
right?
giving them a fair chance by knowing everything that they should be
All or
knowing now.
nothing. All or nothing.
Yeah. Oh yes.
I don't think that there's just too much gray area in everything in the judicial system. And it's just not, you know what I mean? It just makes a mess out of everything.
That's sad.
Same thing with like the 911 calls and like, we're not going to show, no, they need to hear that that's part of the evidence. Like if you use it as evidence to arrest this woman or, whoever does, whatever crime it is, if you use this as evidence to consider this person guilty, then it should be seen.
Yeah, and I understand what they're saying. What I've been watching the last 2 days is that no, yes, let the jury see it. The public doesn't need to see it. The news media doesn't need to see it. As long as they do, because they're the ones that are going to be deciding this case.
You're talking about the pictures?
Yeah, the pictures, the 911 call. We all don't need to hear all that. But the jury should hear it.
See, I disagree partially. I think the pictures, if this was a case where we weren't sure if she was the one who committed the crime, then we should see it. Right?
Yeah.
I think that because we know she did it and there's no question there, I don't think it's necessary for anybody to see it. I think that an autopsy report written down would be good enough, in my opinion. Anything you can question or need to know about, there's nothing you need to see to judge anything. And so, again, I don't think that's necessary. The phone call, I think it should be heard, right? Especially if you can hear her voice, tell the
Well,
kids.
I think so too. I mean, the prosecutor already read the whole thing to it. So, I mean, we all know what was said and what happened.
Yeah.
So,
And I get it's emotional, but it is what it is. Because I think if you start blocking public record, and again, too many gray areas, it's either public record or it's not.
Right.
You know what I mean? And if you start being like, no, we're not going to, we'll hold this back, then you start holding things back from the public. And I think even though you have 12 jurors, if you're going to sit there and try and convict a peer, we should all have the right to sit and be like, is this right? Even though you pick 12 jurors, we all have the right to say, I feel like we should all have the right to watch this happen and say, is this correct? Is there something wrong? We're part of the process that keeps it.
It should all be out there.
Yeah.
I agree with you.
We keep the process clean.
I mean, if it comes up to the judge's decision, at least make sure the jury sees it.
Mhm.
That's what I'm trying to say. Because we don't know what the judge is going to say. I mean, they have a right to do that.
But does the jury need to see it? For what? And again, I would change. If we weren't sure if she was the one that physically did it, then absolutely they should see it because they might notice something or, you know what I mean? But we already know who did it. So I don't feel like it's necessary for the jury to see that. Read the report. You don't need to see the picture.
Well, that's true, but sometimes you get more impact with actually.
That's it. That's it. That's the impact that they want.
Yeah.
You know what I mean? The
Physically
emotional,
feeling it or seeing it.
the
I mean,
emotional impact is what they want. And again, the emotional impact of something so heinous could absolutely change a jury's mind. And let's be real, we all want to act like, yeah, these jurors go in there, they have these rules, they have to be unbiased. They said that they would be unbiased, and they're all telling the truth, right? Except for 10 of them aren't. We can't, how we're human. It's human nature to use our experiences, and it's just, you can't take away experiences, or you know what I mean, beliefs and stuff like that. Like, I think that's always going to come into play, unfortunately, even though it should. You're never going to get a fully biased
right.
anybody.
Yeah, I mean, and I can understand where the husband is coming from. I mean, he has to relive this all again.
But so does she.
Yeah, well, yes, but I mean, I don't know if he. Well, of course he's going to be there. He's going to be the first witness. I don't know if he's going to say.
So
after that
witness, so
or what.
witnesses, yeah, witnesses can't stay for the whole thing. That's probably why they have them first too, is because you can't be in the courtroom if you're a witness.
Well, after you testify.
But after you testify, you could. But you also have the option to leave and not watch it.
Right, right.
You know?
Yeah, that's true. But I mean, I mean, as far, I mean, even some of the stuff I was reading yesterday, it's like, yes, we know he has a girlfriend. I'm not sure if there's 100% there's a marriage there, but people are saying that he had it sealed or something. Can you seal a marriage? Can you hide a marriage?
No.
I mean, why would he do that anyway?
But I believe he is
understand that
married,
part.
and she never changed her name, which is why people are questioning, is what I heard this morning.
Because I'm hearing conflicting stories. Some say no, he did get divorced, but he is not remarried, but he does have a girlfriend. And some people are saying no, he did remarry. I was like, so I don't know, so I can't say what it is, but
Yeah, I heard that he was married, but she did not change his name, her last name, because she's a doctor, and she kept her last name. So
yeah.
So it's the
Yeah,
name
he's
change
a
thing.
fertility doctor.
Yeah. First of all, let me tell you something. Okay. If doctors are ultimately the ones that cause this that you believe, are you going to go marry a doctor?
Yeah, I know,
Like,
really.
it's a little weird to me, but all right, whatever, you know. Like, I don't know.
And a fertility doctor at that.
Yeah.
Yeah. And she looks so much like her. Oh
She,
my God.
I mean, he's got it tight. You
Yeah,
might
when
want to
I
make
saw that
her.
picture, I'm like, are you kidding me? I thought I was looking at the wrong picture. And then like I said, I went to her Instagram. I'm like, wow, she looks really like her. He has a type. Yes, definitely.
I wonder what she thinks about this whole thing.
Do you think she knows
Do I think she knows that this?
about the potential girlfriend, wife, whatever she is, or seen her?
I'm sure she knows, because they seem like they still talk and they're close.
Yeah, it does seem like they do.
You know, and I can understand that. I don't, just because I may still love you, I may still care for you, I may understand that what you did wasn't you, and that there were reasons for it, but I don't, the marriage would have to end at that point. I couldn't stay married to somebody that
And I'm
did
sure
that.
she understood that
Yeah.
too, but she doesn't know where she's going. But anyway, I'm sure she understood that, and he even came out publicly and said that he forgave her.
Yeah. And I don't know that I believe that either, though. Like,
Yeah, I don't know. That's
can you really forgive? Understand. I understand is one thing, but to say I forgive, I don't know. Maybe I just use certain words. Like, to me, words like love and forgive have meaning. And
Yeah.
some people use them a little more, you know what I mean? Tallulah, thank you for the follow.
More too freely.
Yeah.
See, I don't know if I would, like, say if my husband did something like that. I could say, I could probably feel bad because I knew about the relationship we had, the love that we had. I don't know if I could forgive him for doing something like that.
Yeah.
I honestly couldn't. I don't think I could.
Yeah, to understand and all of that is one thing. To truly forgive is, I don't think people realize what that entails. To truly forgive someone of something.
Right. Especially something like that. That's
Mhm.
very deep. I mean, Yeah, or maybe he does it and he says that out of guilt.
Yeah.
Because he could be feeling guilty as well, thinking, well, maybe I shouldn't have left her alone.
As he should. Like, let's be real, even though I understand the decision he made, I understand the stress that was upon him, still, you're leaving her when she told you her thoughts and played a role in it. Now, again, I don't know that he's responsible. I'm not saying that, but it did play a role because you
Yeah.
knew she told you. And so I'm sure there's got to be guilt, and there definitely is responsibility there to some extent.
And what I don't understand as well, because he went out to go get the dinner and the thing at the pharmacy. Now, both of those items they could have had delivered to their house. Why? Why didn't he?
Yeah, I don't know the area she lives in because I know some people like Sam can't get like DoorDash and like, I don't know, do they live in a city area? I don't know where they live. If that's available out there, you know what I mean? But again, if it was 5 minutes down the block, then probably. I don't know. But again, I'm not saying she definitely could have been trying to get him out. That makes sense in her mind frame.
Yeah, yeah.
Because she knew he would have stopped her.
Yeah, I don't know. It's kind of confusing because I was thinking about that last night. I'm like, well, those items, I mean, they could have had them delivered.
Yeah.
Maybe for him, like she was saying last night, maybe he just wanted a few minutes to himself.
Mm-hmm. I'm definitely a pull into the driveway, just sit in the car for a minute and woosah, get your thoughts straight. Like I tend to just sit in my car in my driveway, to just,
Oh yeah, I used to do that when I get home from work. It's like, give me 5 minutes in the car, okay?
Yep. That drive wasn't long enough. Megan just said something. Megan, I appreciate this comment. It says people have to come up with a personal definition of forgiveness and what it looks like to them, so they can achieve forgiveness and be able to move on. Yeah, I guess you're absolutely right. You know what I mean? Like, what is forgiveness? I guess it is a personal definition, right? What does it mean to forgive somebody? It's to each his own. What my forgiveness and your forgiveness look like may be two completely different things. So yeah, that's interesting. Yeah, you're absolutely right.
Yeah, so Ellen's saying they could have got their DoorDash. She only lives 15 minutes from there.
I do believe that she was planning it, but I do believe that was the mind frame she was in because she was getting told there were commands, right? So, and I do, or maybe she wasn't planning it. Maybe she just wanted dinner. And again, her mind frame was already in, all right, he's going to be gone for 45 minutes. I just got to make it 45 minutes.
She was looking up times and how long it would take.
And so if her mind frame was already like, man, I only got to survive this 45 minutes without him, her mind frame might have placed her into that psychotic state because she was already knowing and afraid and thinking about it beforehand.
Right.
Knowing the panic of knowing that he could be gone could have triggered a psychotic break or episode at that point.
I don't know. It's hard for me to think because then I'm thinking, well, I mean, she could have said, please don't leave me or take the kids or something. I don't know.
Yeah.
Or I'm thinking this way, like she told him in the past how she was thinking. So why couldn't she do it then?
Well, she did say in what I just read that the voices didn't start, like they were going all day. They were going constantly for, you know what I mean? It was something that she just dealt with, but the voices got really loud and really once he left.
And then I noticed in what you were reading as well is that, she was saying she couldn't sleep, she couldn't drive, but then that day she brought her daughter to the doctor.
Right. I agree.
It's confusing.
I don't understand how, right. I feel like, at one point though, do you hold yourself in and not like you have to live, right? You have to go through the motions of doing these things. Like, so I get that. I kind of see that.
Yeah.
Yeah. Like, were they supposed to all just stop living and sit in this home and never leave, never go to doctors? He's downstairs working, the kid's got a bellyache. Like, what are you supposed to do if nobody's listening to you and saying, hey, there's red flags, I might be dangerous. You know what I mean? And then what are they just supposed to? Is he not supposed to
I
work?
don't know.
Not pay
I
bills?
think she kept herself busy to try to not have those thoughts, but
Yes.
it wasn't working. But that's why she overexerted as far as exercise, and what she did in her daily life, she just kept herself going constantly.
Well, yes, but you also got to remember that's also a symptom of that, doing those things. And probably to keep their mind preoccupied, I guess, with a different fixation or a different obsession.
Yeah, I don't think she realized by doing that she was making herself worse.
Right. Did her daughter already have an appointment scheduled ahead of time, or was it a last minute stat care thing? I think it was a last minute. She had a bellyache. She took her to the doctor, kind of thing. I don't think it was like a planned physical or well child check.
Or
anything
maybe
like
she
that.
couldn't think. I mean, because she's a nurse. I mean, she couldn't have thought that about her daughter, or tried to figure that out.
I see. I don't know because she is a labor and delivery, but as a nurse myself, I don't ever diagnose my children or assume I know, because I know my limits when it comes to children. Even though as a mom, it's kind of hard for me because as a mom, I've had experiences. I will always opt to take my children to a pediatrician first. You know what I
Yeah, but
mean?
with my daughter, like some of it, it's like it's in you as a mother. Because I always knew, I mean, just because my daughter had a stomach ache, I didn't run her to the doctor. I mean, if she was throwing up 24 hours, yes, I would bring her.
Yeah, I mean,
I don't know.
was she
I'm just trying to
thinking?
think of every
Was she
avenue
thinking
of
that
what,
maybe it was something like appendicitis or something a little bit worse than it actually was? You know what I mean? I don't know.
I mean, especially when they're that young, you do keep an eye on their bowel movements and all that kind of stuff because, they can't tell you.
Yeah.
You know?
Now, has any of her family or his family spoken? Like when this came out,
No.
I know they got Facebook pages. I'm not gonna lie, I went there, but I don't want to, you know what I mean? I'm just curious. I want to go to her page and look at her page from back when she was doing the exercise videos on Facebook and really get a glimpse of who she was.
Yeah,
You
yeah.
know, like I see if you can see a change in her social media posting. Did her presence online change just from, what she was showing the public? Was there a change in
Right.
her persona? Like I feel
But I
like there's a
think,
lot of you that have watched me for so many years that if I psychologically changed, y'all would know a difference, right? Like be able to pick up and be like, hey, what's wrong with Ivory over there? This isn't her.
well, yeah. I mean, when I was younger, like a teenager, I had a couple of friends that had unalived themselves. And one of them, I physically talked to him like 5 minutes before it happened
Mm,
because he went home right after that. And he was jolly and happy. And most people who do that, they do. They put on a persona like they're very happy, they're very this, and you would have never thought that they would have done something like that.
Do you want to know why they're very happy, or why they believe that they're very happy? When they finally make that decision to do what they're going to do, it's kind of a relief for them. And so that's why they have
Yeah,
this, it's no
yeah, I
longer a
guess so.
burden.
Yeah.
I've made that decision. This is what I'm going to do later. This is, I've already made the decision. And so it's kind of a relief for them.
Yeah, I can understand that.
And so then they don't have the burden of it anymore. And so they're like, you know, and again, it's like the planning, taking her to the doctor, getting her the Miralax. Like, I mean, if this woman was planning this, she wouldn't have done all that. You know what I
Right.
mean?
I mean, she could have been fighting within herself internally, having
Yeah.
those thoughts and then going on with her daily life as well, knowing what she had to do.
I'm sure
You
at
know?
some point it was an internal struggle until she just had no control anymore. Right? It
Right.
just escalates. Man. I don't know.
Yeah, Glen Rose is true. I mean, me and my husband were talking to this guy literally 5 minutes before that it happened because he only lived around the corner from us. And it was just very shocking. It's still shocking to this day, and that happened many years ago. Yeah.
Wow. I don't know. This one's a hard one. It's really interesting, though. It really is interesting. I'm curious to see what the jury says, and I'm curious to see what they put out there as far as evidence. What do you think about them not allowing the people who have experienced this before to speak, to be called as witnesses?
Are they not allowing people to?
No. The
I
judge,
thought they were bringing, well, no, I guess people who've been through it know. I know about experts, or even trying to get some experts not to testify on, but I'm like, why?
but
I
let,
mean,
but let
you
me,
gotta understand what she was going through.
right. So my whole thing is, if you're somebody who went through this particular thing that we're saying that she had, don't you become an expert as far as experience? Because people can be experts in a field but never truly experience it. And without that experience, you really just don't know. It's all just education and assumption. And but somebody who is actually in the position of being in the psychotic break, a psychosis,
Right.
that's a level of understanding that these experts wouldn't have. And I feel like that's very important. And I feel like so they become an expert in their own right just out of experience, which experts can be experts because of experience. So how are
Well,
they not
Nina,
considered an expert?
Nina, I understand what you're saying, because when I was going through that with my sister, that's the first thing most psychiatrists will ask. Do you have any family members? Do you have any children? Whoever, they want to speak to them. Because sometimes the patients themselves will hide it, which my sister did, until we went in and said, hey, okay, this is her mother, I'm her sister, da 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 da. And she was not telling them everything that she should have told them. So you can't help someone if they're not telling you. You know what I mean?
Yeah. Yeah. You and Sam take over for 2 seconds. Give me 2 seconds. I'll be right back. No
Okay.
pressure, Jamie.
Yeah, sure. I just hope they do. They don't. The judge does not say, "Okay, we can't have this expert or that." But I mean, that's the whole big part of the case, to explain how she got to where she got. You know. Oh, I don't know if they will allow someone on the jury. I mean, I don't know if those questions were asked when they were picked to be a juror as well. Do you have family members that have gone through something like this or whatever? I mean, I know they gave them a questionnaire, but I don't know exactly what was on it. Yeah, it's tough to know, but I think they should allow a lot of this testimony that they want out. That's because it'll give you more of an insight of what was going on in her daily life, with her children, her husband. You know. Yeah, it's a tough one. You did, Ellen? I know the last two jurors, because two had jumped out, so they had to get two more yesterday in a hurry. And they claimed the last one they just picked no matter what they said, because they had to have that. The judge told them that they had to have it before the end of the day. So once they swear them in, they can't say, oh, okay, I'm not doing this. But they're not sworn in yet. So that's why those other two were able to say, hey, can I be disposed of doing this? Because I don't feel comfortable.
I wonder how many people like, yeah, that's going to be a hard one to sit on.
Right. Yeah, well, I know one, they were saying, because it's going to be 6 to 8 week trial. One guy was worried about losing his job and losing the money, that he was making for his family. And the other lady, I guess she decided because of the children, she just couldn't go through with it.
That's completely understandable. I
know her mother is. I don't know about her father.
Yeah, her parents, her sister, she does have, I believe even his family is supporting her. I'm really curious to hear people's perspectives, like the family.
Yeah. I would like to hear that too, because I mean, maybe they could be supporting her because they knew that what was going on, and maybe they didn't know how to
They
help her.
did. She told them.
Yeah, yeah.
The sister was calling the doctor too. Like, I can't imagine my sister going through something like this and telling me, and just, man.
Right. I mean,
can't
I just
imagine.
around. I mean, just to see how much help that she did try to get, and people that she told, and she just couldn't get the help that she needed.
She was pretty much screaming it from the rooftop. I mean, there's nothing left that she didn't do. Adria, this is the Lindsay Clancy case that we're talking about. She's the mother who killed her 3 children and then tried to kill herself, and claims to be in a episode of psychosis.
And she's actually paralyzed now.
This one is, I feel like, man, I think for me, it's just so blatantly obvious that she tried to get help. She was going through this and she didn't get the correct help, that it was completely understandable to believe that she was in a psychosis. I don't know how we're questioning it. I'm curious to see what the prosecution has that counteracts this. You know what I mean? She jumped out of a 2nd-story window.
I can see why they brought up these charges and stuff because, well, she said she was guilty herself, but I mean, because, there's 3 innocent children involved, and I think that's a big thing for a lot of people.
Mm-hmm. Yeah. I just don't understand. And I don't understand the fighting it, because it's not like this woman's asking to be set free. Neither one of these options puts this woman out on the street or says she didn't do it, or, you know what I mean? One is just, is it better for her to be in jail, in a prison, or is it better for her to be in a mental psychiatric institution?
Lori, she tried to unalive herself, that she jumped out a 2nd-story window.
Right. I want justice for those children, but her waking up daily is already a life sentence. I get the justice for the children. I really do. But again, it's not like we're saying let her walk free, or she's saying let me walk free. Like, obviously this woman is we're still going to question the help that she's been begging for years, and we're still not going to allow her to get it. Obviously there's something psychologically wrong with this woman. And now we're sitting here going, just send her to prison or let her be in the facility. Well, she belongs in the facility. It's what she was crying for forever. She needs to get help. And we're still not allowing her the help she needs. It doesn't make sense.
I think they're having this is the decision whether she's going to go to prison or be in a hospital for the rest of her days, because she's not denying, that she did it.
Right. And then, Nina, you got to understand. So how it works when you're put in a psychiatric hospital is you're there, you get treated. Every year, the court comes up with a review. Now, it's up to the doctors to say, yes, she's completely cured, she's safe, she's this, she's that, she's had enough therapy, she's better. It's managed, she'll never be better, but it's managed. She's not a threat to herself, she's not a threat to anybody else. And then after that, then it goes to the court, to the judge, and the judge decides whether or not she can be let out. So ultimately, it's on the judge anyway. It's not like the doctors are going to be like, yeah, she's healed, here's a discharge. It still goes back to that judge who decides whether or not she's ready to be let out. So, you know what I mean? I feel like...
the tough one for me is when she said that she still wants to have more children.
Who said that?
She said it.
I mean...
And I said, well, if she gets out, is she going to try to have more children if they let her out, say, in a few years and say she's fine? Or, I don't know. That's a tough one for me.
Just because she's saying she wants more children doesn't mean she'll have more children, right? I want more children, but I'm not going to have any more children. I feel like, that want for your kids, like, man, that's a hard one. You know, having children is like, I don't know. I mean, she could say that she wants them, doesn't mean that she's going to have them, or she didn't say she's going to go out and try. But again, like, she can be in that hospital for decades to the point where she couldn't have children. And
Yeah, 'cause I'm trying to remember that interview yesterday because I think her husband even said it too, that she wanted to have more children. This was after this has already been said and done here. Which I thought was, I don't know if she feels that way out of guilt
yeah, definitely could be.
and she wants her kids back and she feels that maybe that's the way to do it is have more. I don't know.
Definitely possible. Not Jamie K in the comment section talking about, Ivory, I'm concerned you might be in psychosis now. See, y'all would see a change. Yeah, I don't know. I mean, she's still human. I don't know. She's still human, but is she cured of her whatever? You know, she's still sick.
I think especially bipolar, that's not curable. So she's going to have that for the rest of her life.
Right.
So
yeah, and it's a maintenance at this point, you know.
Right.
So, oh, I'm sorry.
Okay.
We had court. We thought we had court today, but then we didn't have court. So
I was worried about
Yeah.
it. You didn't answer.
Why would you be worried about me?
Because you didn't answer my text.
My husband talking about coming in going, are you okay? And I'm like, wait, why am I feeling crazy? Why would I not be okay? And he's like, well, I texted you. You didn't answer me because, of course, I've been on here with you guys. And he's like, I got a little worried. And I'm like, get out of here.
He's probably thinking, okay, she's coming out of the room in hours. Okay.
Right? Like, she didn't answer my text or my call to let her know I was on my way home. And then, get out of here with your worry. You should be worried for you.
Why? What I do?
You're so funny.
Oh, I didn't mean to panic you this morning. She told me this morning when I was.
Oh, that's all right. That's okay.
already,
That's so funny.
And I left early this morning because I didn't want to be there past 4.
No, you're good. But thank you for this, though. I appreciate you bringing this
I
home.
figured you might be running.
Yeah. That's so funny. He was like, I'm worried about you. You didn't answer me and he texted me on the way home. So it's not like he's been texting me all day. That's so funny.
Bethany do all right today?
Yeah, she's at her friend's house.
Did she clean her room and the bathroom?
Yes.
Or this morning?
Yes, she did.
But not yet. No, he's gonna drop her off. I dropped her off. He was like, I'll bring her home.
Okay. Sorry, guys. My husband talking about, I was worried about you. You didn't answer my text. Well, what the hell did you think I was doing?
He thought you were having a party.
Right? Like, what did I do? That's so funny. You want to know why? Today I had the house all to myself, guys. There was nobody home until my husband just walked in the door. All of my kids are out. All of my kids are out. My husband was at work. I was so excited today. And I'm like, I don't even know what to do. I've never been home alone. That's funny. And I spent it with you guys, Holly. That's so funny. Yeah, I work from home, so I still have to get some stuff done. Man, I can't believe we gotta wait till Monday.
I know.
I can't,
I know.
I'm curious.
Right? Why can't they have court 7 days a week?
Right? What kind of crap is that?
At least Saturday, a half day. Do some opening statements tomorrow, and we'll hold over Sunday.
Right?
Until
Keep
Monday.
Sunday. We'll let you have your Sabbath, your day. I
I said 4 to 6 weeks, you guys.
yeah.
They're
Yeah.
saying 6 to 8 now. They were saying yesterday.
See, that's a lot. That's a lot. I know her witness list was like 200 people. That's wild.
It can go faster or it can go slower.
Yeah.
We don't even know.
You know what I found last night, and I have to find it. I'll put it on our page that we're about to make. Jamie, and who else was helping me? Or not the page, but we'll flip it up there. Yeah, I'll put it on the page.
Did you guys want a Google Doc or did you want a page?
We're gonna have to talk about that because you're speaking in hieroglyphics to me.
I mean, wouldn't you think a Google Doc would be easier for people?
Yeah, I do.
I just want something that people can click on and not have to do anything. They can just click on it and see it.
Well, just let me know. I can upload everything on a Google Drive.
And then we can all post the doc to our pages this way.
Yeah,
And
I
have
think it
access
would be
to it.
quicker and easier that way instead of trying to manually put in all this information. You know,
Mhm.
It gives me something to do this weekend.
Yeah.
So to hold over because, like, you know, honestly, I do get kind of bored. So I like doing stuff like this.
Yeah. I think it'll be really helpful for people to go back and look at things that they missed. You know what I mean? And again, for those of you on TT, this will be replayed. This live will be replayed over on Facebook and on YouTube. So if you guys missed anything, you guys can see it over on those pages as well. But you know what I saw last night? I don't remember what I did with it, where I put it. I have to find it for you guys. The timeline. It was so nicely written out in the timeline. And I was like, you know, when you look at the timeline, it's, you know, you think she was asking for help like once a month. It was literally like every few days she was calling someone, going somewhere. You know what I mean? Like when you see how often she was reaching out to people for help every few days, it was for months, it was wild. It's wild to actually see, you know, you sit there and say she was reaching out for help. Was it once a month? You know, every couple of weeks, she called the doctor. Every couple of days. It seemed like, you know, only days would pass. So, like, to really see that really opened my eyes. And I'm like, wow, she really was, you know, I always knew that she was calling out for help, but, you know, this is often, like, this is like red flag. She's screaming from the rooftops. How could nobody had listened? Yeah.
Right. It's sad.
You know, and thank God this doesn't happen too much. I feel like this is just one of those cases where you get one doctor that's not taking it so seriously. And again, doctors have things on their mind, personal lives that they shouldn't let interfere, but somewhere people drop the ball. And I think that people drop the ball and assume somebody else would pick it up and catch it, and they didn't. And you know what I mean? All the systems that are put in place to catch this, she did the whatchamacallits, the what do you call it? What's the word I'm looking for, guys? The scale,
So when they
I can't think of the word.
test you and
Yes.
you're on a level on the scale, yeah.
Yes, you know what I mean? Like the what do you call it? The questionnaire thingy.
Yeah, it's like the questionnaire scale when you go to the doctor.
The GAD-7, and she did that. Mm-hmm.
Yeah, the GAD.
Both of them. She did both of them, and both of them, her score came off the charts for severity and, like, you know what I mean? And yes, One and Only did a really good timeline that I'll show you guys. Oh no, wait, One and Only, what did you send me? The medications, which I'll put up there too, if that's okay with you. Like the list of all the medications and the dosages, and that's wild to look at too. Go ahead, Sam. I didn't mean to.
Did she just go to primary care, or did she go to a psychiatrist ever?
Psychiatrists.
Yeah.
Wow.
Yeah, it's like, you know, I don't know, man. It's
just think about it. That had to be so scary for her family and her husband alone. I mean, just to go through all this.
Think about how it was for her.
Yeah.
I mean, can you imagine hearing a voice that, you know, people don't hear telling you to do the most horrific thing imaginable? And then you try to ignore it. And has anybody ever had ringing in their ears that doesn't go away, and you try to talk and it's like really annoying and you can't keep a thought because it's there? Like I had.
My husband crazy.
Yeah.
The tinnitus.
Yeah.
It it can make you crazy.
Yes, and it's like, and sometimes it gets really loud, but then sometimes it eases down a little bit. And it's like you never know when it's gonna get really loud, and it's there, and you're just like you're trying to talk through it, hold conversations, and nobody else can hear what's happening in your. Can you imagine a big voice, a big man's voice going, "No, you have to kill the children. You have to kill yourself." Like that's wild to think of that was in the back of her head as she's trying to carry on these blase, normal, everyday conversations. Honey, let's put a carrot on the snowman's nose as you're hearing they gotta die. Like that's wild.
My dad, he would get into a drug-induced schizophrenia, and kind of sad. You don't remember really anything from my childhood or what he did
Yeah.
during those episodes.
Yeah. You know,
And it wasn't like he did anything bad. Like one time, he was probably in psychosis. He told me he was a fish. You know, like
wow.
it creeped me out because I was like, what?
Wow. That's, yeah. I mean, that's, I don't know. It seems really scary to me. That's how frightening is it? And you know, some people remember, some people don't. Some people remember parts of it, but to wake up and we realize what you did, I don't know.
Yeah, I mean, I tried to ask my sister about it, like, why or how did you come to the, and she would always tell me, I don't know.
Yeah. You know,
I
because
mean,
at the
it
time you
was-
could justify whatever, but then there was no justification afterwards. You're just like, I have no idea what led
I
me to
mean,
that.
back then I always dreaded the phone calls because it was 3 times she attempted to go off a bridge, and thank God I knew the police department and they knew what was going on and they called me because they knew who she was. I mean, now she's fine. This happened like over 20 years ago, but she's on the right medications and everything now, and she's fine. But you know, just trying to talk to her even about it now, she says, I don't know. She doesn't know what made
Man,
her think that way, or you know.
So I'm gonna say this. If anybody's sensitive, trigger warning, it is self-harm. My uncle, he was the most normal guy. He had, him and my aunt had owned several homes. They'd vacation all the time. Like, they lived a good life. They lived on the water. And he was like, to me, the most normal person in my family. He one day, they went to Dry Falls in Washington, which is like, it's kind of like the Grand Canyon. And he looked at my aunt and he said, I love you and I love the kids and I'm sorry. And he ran and jumped off of it and unalived himself
Oh my Lord.
in a split second. And he was on medications. He was the only survivor of a car accident back in the 70s, I guess. That's all we can think of was maybe he stopped taking his meds. We're not sure why. There was no issues in the marriage. You know, and it was just that split second. And when I was told, I go, oh no, he got in a car accident. And when I was told what he did, I said, no way. You know, it was shocking. So
I remember
you
you
never
telling me
know.
that story
Yeah.
before. How wild is that? That you're just sitting there hiking and all of a sudden you just look at everyone and in that split minute you just decided, you know, it
was
happens.
200 feet down, and it took him 2.5 hours to recover him.
Like a split second, your thinking process changes to something so drastic. Wow, that's horrible. I'm
Scary,
sorry.
very
Yeah.
scary. You never know. I mean,
Yeah.
yeah, like with my sister, like she never gave me any type of idea, just watching her on the daily, that she was thinking that way.
Wow. Man, this one's a really hard one. I feel like part of me is like, can we just give this woman the help she's been begging for so long? Like, can we now let her sit in the psych hospital and she's got even more trauma and stuff to deal with. She'll probably never get over. Like, can you just give her the help she pretty much begged everybody for? Like, this is our chance to do right by her. And I feel like that should be our duty, is to do right by her now, give her the help she begged for.
Well, and she's got to live with this the rest of her life, which she did. So I feel that is punishment too. I mean, obviously the kids are the ultimate victims in this whole thing, and even the husband's a victim in this. Everybody's a victim in this situation, and it's just really scary. I think it's something that women who are going through either like perimenopause, menopause, or having birth or postpartum really need to pay attention to their habits changing, and so do their families.
Yeah. Kazoo said, so is she on any medications now while she's in custody? So Kazoo, she is in a state psychiatric facility while this is happening. She's currently there. I don't know her medication regimen. However, I would assume she's on medication, right?
Yeah.
That's a safe assumption. But yeah, she's not in prison right now. She is currently in a psychiatric facility where she needs to be.
Yeah, I think so as well.
And again, ultimately, after her care is done, it's up to the judge whether or not she gets out. And so I feel like, I don't know why we won't allow her to be in the facility.
I think she should stay in the facility. And I hope even if she does get a chance to get out, I hope she says no, because just for the situation, maybe just because she's in there now, they might have her well controlled on medications or whatever it may be. For what she tried to do in the first place is unalive herself, that she might do it again if they let her out.
Mm-hmm. Yeah. And again, ultimately, it's not only up to the doctors. It's not only up to the doctors this time, but there's also a judge overseeing it, right? And so it's up to the judge as well on whether or not he lets her out. So that's a sentence in and of itself. It's not like she's asking to walk free.
Right.
Thank you so much. Thank you. I appreciate it, Kazoo. Thank you. So I don't see why we're fighting it. Like, why would you want her to sit in a prison where she still could be a danger to herself and others? And
yeah, but she wouldn't get the help she needs going to a prison.
And the woman begged for it for so long. Can we just give it to her now? In my opinion, the system failed her.
Definitely, yeah.
And this makes me want to revisit Andrea Yates' case. I haven't gone through that case in a long time.
Have you seen the documentary?
No.
The new one? It was just out, how many months ago?
No, was there?
Yes, there's a new one out, and it explains, the type of religion that her and her husband were in, in certain ways and aspects, the way her husband controlled her.
Oh.
Yeah, you got to see this. It's good.
I got to watch that.
Yeah.
I don't know much about Andrea Yates, but I do know. Sorry, my son's playing with something. But I do know when I was a kid, because when did this happen? Like 95 or something like that?
Yeah, it was in the 90s.
I do remember my mom talking about it a lot. So I think it jolted her. I remember that.
Yeah, I saw that as it was happening. It was like, oh my Lord.
She drowned her 5 children in the bathtub on June 20th, 2001. She had exhibited severe postpartum depression, postpartum psychosis, and schizophrenia in the years leading up to the murders. She was sentenced to, let me see. Yates was convicted of capital murder, but the jury refused the death penalty option. She was sentenced to life in prison with the possibility of parole after 40 years. The verdict was overturned on appeal in light of false testimony by a prosecution witness, forensic psychiatrist Park Dietz. On July 26, 2006, a Texas jury in her retrial found that Yates was not guilty by reason of insanity. She was consequently committed by the court to the high security North Texas State Hospital in Vernon, where she received medical treatment and was a roommate of Dina Schlosser, another woman who committed infanticide by killing her infant daughter. In January 2007, Yates was moved to Kerrville State Hospital, a low-security state mental hospital in Texas. At the
I
time
want
of,
to know what she thinks is worse, prison or the state hospital.
well, she won't allow them to do the review. Yeah, I'm curious to see which
Yeah,
is worse.
she keeps waving it. She doesn't want to leave.
At the time, excuse me, at the time of the murders, the Yates family, they were living in Houston. She was under Dr. Saeed's care until June 20th, 2001, when her husband left for work, leaving her alone to watch the children against Dr. Saeed's instructions to
Right.
supervise her around the clock. Rusty's mother, Dora Yates, had been scheduled to arrive an hour later to take over for Andrea. In that space of the hour, Andrea Yates drowned all 5 of her children. Yates started with Paul, Luke, and John, and then laid them in her bed. She then drowned Mary, whom she left floating in the tub. Noah came in and asked what was wrong with Mary, then he ran, but Yates soon caught and drowned him. She left him floating in the tub and laid Mary in John's arms in the bed. She then called the police, repeatedly saying she needed an officer, but refusing to say why. She then called Rusty and told him to come home right away. Yates confessed to drowning her children. Prior to her second trial, she told Michael Wellner that she waited for Rusty to leave for work that morning before filling the bathtub because she knew he would have prevented her from harming them. After the murders, police found the family dog locked up. Rusty advised Wellner that it had normally been allowed to run free and was so when he had left the house, leading the psychiatrist to allege that she locked it in a cage to prevent it from interfering with her killing the children one by one. Rusty got a family friend, George Parnham, to act as her attorney.
So you were talking about, I heard religion and then John, Paul, Luke, and John, or whatever.
Mary, yeah.
Mary, so it leads me to believe, she was held to a standard. You stay home, you got to take care of the kids,
Yeah, he was making her have child after child, after the other. I mean, if you watch this new documentary, he's in there talking on it, but I don't like the guy. I just don't. I think he just didn't care.
He sounds like he was probably hard on her too. Like,
Yeah.
dinner had to be done, that old fashioned done. You take care of the kids. I bring the bread. I'm the breadwinner. But when I come home, you wait on me too.
Here it sounds
like in this cult-like religion. I can't remember the name of it offhand right now, but it was like a cult-like religion that he was in.
Pentecostal.
No.
Here, however, it's saying that the doctors told him not to leave her unattended, which you cannot put that responsibility on another person. If this woman was dangerous, a danger to herself potentially, or a danger to those children, they should have locked her up. You can't put that on somebody else and make somebody else the responsible one for that. However,
when you see this documentary, you'll see that the doctors advised after, I forgot how many pregnancies, 2 maybe, and she had 5 or something, advised her not to have any more children because what it did to her. And he just continued forcing her to have kids. So,
According to trial testimony in 2006, Dr. Saeed had advised Rusty Yates not to leave his wife unattended. However, Rusty began leaving her alone with the children in the weeks leading up to the drownings for short periods of time, apparently believing it would prove her independence despite her doctor's instructions. Rusty had announced at a family gathering the weekend before the drownings that he had decided to leave Yates home alone for an hour each morning and evening so that she would not become totally dependent on him and his mother for her maternal responsibilities. Wow.
Yeah, he didn't believe there wasn't anything wrong with her in his eyes.
Oh, listen to this.
You're asking Jamie.
It's on Netflix.
Listen to this one. Andrea Yates' brother Brian Kennedy claimed during a broadcast of CNN's Larry King Live that Rusty expressed to him in 2001 while
Let me see what the name of it is. Hold on. Go
Well-
ahead. Sorry.
that's okay, while transporting her to a mental treatment facility that all depressed people needed was a swift kick in the pants to get them motivated. Her mother expressed shock when she heard that Rusty's plan while at the gathering with them, saying Yates wasn't stable enough to care for the children. She noted that Yates demonstrated she wasn't in her right mind when she nearly choked Mary by trying to feed her solid foods. Wow. There's the
So,
stigma.
How old was the youngest?
Thank you. I don't even, hold on, I'm gonna have to, hold on. Oh, sorry, thank you.
We'll get out there.
Hold on one second, I'm trying to look up the age of the,
You're doing that. There was this lady, an Amish lady, and she drowned her 8-year-old, I think. And I think she pleaded insanity as well. Oh, 8 months old, Ivory.
yeah, no, 6 months old. 7-year-old
Okay.
Noah, 5 years old John, 3-year-old Paul, not Noah, John, Paul, Luke, and Mary. Paul was 3, Luke was 2, and Mary was 6 months.
That's a lot for somebody to take care of 5 kids all under the age of 7. A whole lot. So, as you can hear, my 2 is enough in the background of my teen. I have 3, and I'm good.
Listen, I have 10 kids. You all know that about me. And, you know, it wasn't easy, right? I enjoyed it, but it wasn't easy. It was, you know, I'm very organized and very like, it was work, right? It was like a full-time job just to learn how to organize my parenting.
That's why I don't work. I stay home. Because I've got 2 under 4 now. And it's a lot of work. It is. And for me, I'm a schedule person. Like my kids are on a schedule. We take a nap at a certain time. We go to bed at a certain time. We wake up at a certain time. So if I couldn't imagine working labor and delivery and having little ones either. That's a strenuous thing.
You know, I feel like I get her case, but her case is even, I don't know. I feel like it's very close, but I mean, the doctor knew what she was in, right? The doctor knew that this was a potential. I feel like at least somebody knew what she was going through, where Lindsay Clancy didn't get that from the doctors. You know what I mean?
Okay, I made a mistake. It's not on Netflix. It's on HBO Max, and it's called The Cult Behind the Unaliver.
Man, I don't think I have HBO.
I don't, but I'll get it to watch it.
I was like, you know, I wonder if we can like, I don't know, play it. Yeah.
Yeah, 'cause it did seem like he was in a cult type religion, if you ask me.
Can somebody Google? Actually, I will. I want to Google what religion it was.
And it's actually 3 different parts to this, so they're like about 42 minutes apiece.
Roman Catholic, but later adopted strict fundamentalist evangelical Christian beliefs. Her religious views became heavily influenced by the teachings of an independent apocalyptic preacher named Michael Wernicke,
Yeah, Wernicke.
which emphasized
Yeah.
rigid gender roles and the belief that the world was destined for hell. Oh, well, there's that.
And that guy in the aftermath is saying that Wernicke guy deflects blame. I guess
wow.
onto the husband, or I don't know who.
That's wild. How can a doctor, though, put that responsibility on a family member? To me is wild. Don't leave her alone ever. Like, what?
Yeah, 'cause they're saying that Warnecki guy, his followers, they seem trapped in isolation with his teachings and I guess how he told them they had to live.
I mean, is he a prophet? Is that what? I mean, what is he? That's wild. Stephanie said it's on Hulu as well.
Is it? Is this a new
What
one?
was the name of it again?
It's the cult behind the unalive, you know, with the K word. The Andrea Yates story,
Mm.
2026. So this is a new one.
Oh, I got it.
It's and like I said, it's 3 different parts and they're 42 minutes apiece.
Let me see.
I mean, back then when this was all going on, I never knew a lot. I mean, just watching this was, you know, I've seen it. There was another documentary, but that was years ago. But none of all this information that people know now, or what she went through, or what he's discussing now, because he is in these, you know, they interviewed him.
Oh wow, wait, here's the thing. Hold on, let me listen to this.
Yeah.
It's 44.
No. So Andrea Yates not only suffered from postpartum depression and apparently eventually a psychosis, but she was also under the control of a cult.
Right. I mean, her husband brought her into that. He's not saying that part. You got to watch the whole thing. He throws me off. I don't like the guy. You know, he's like putting the blame everywhere else but himself.
So it's kind of like the West Memphis 3, one of the stepdads. I forget his name, and he's creepy. He is creepy.
All right, guys, I am giving everybody homework tonight. We're all going to watch The Cult Behind the Killer, and we will reconvene later to see what we think. I need to watch this.
Yes, you do.
She said, yes, you do. I'm really curious. Like, I remember the story. Why do I not remember the cult?
I never spoke of that before until this documentary.
I mean, I don't remember this being a part of that whole case. So did she hear voices as well?
I'm trying to remember.
I thank God.
I gotta watch this again because I don't remember everything because this was months ago. I saw it. I'm gonna watch it again though. But
Man.
I just
That's really interesting.
God.
Yeah, well, now we have a reason to watch this because we're all going to talk about. I really want to watch this and then try and, we'll see what the differences and the similarities are with Lindsay Clancy. But I'm really, I can't believe I didn't know there was a cult happening here. That's wild.
Yeah.
That right there can cause someone to psychologically break. Forget about the whole postpartum and the children and the.
Well, yeah, that on top of that, because this guy was very controlling. Her husband was very controlling. He's not saying that, but he was.
So she's sitting here like, I don't want to get out of here. That's why she's like, I'm good here. I'm good. I'm good in my little mental institution. I don't want to be around. Like, I'd be afraid to leave too. Shoot. And then knowing that you did that to 5 kids and then laying them in the bed, and that's psychotic. Wow. I can't imagine. The fact that he said that people with depression just need a swift kick in the ass is wild.
What was the one where the lady drowned her kids in her car?
Oh, that was Susan.
Susan, yeah.
Susan Smith, right?
Yeah.
Yes.
Yep.
Look at her. She's on national television begging for the people who did that to her kids, and she said it was.
Now
I think she said it was
that.
a black man. I believe she blamed it on a black man.
Now that woman did it just to do it. I don't believe that had anything to do with mental illness. I mean, obviously it did, but not the kind we're thinking.
Well, the guy that she was cheating on her husband with did not want children, and she claims now that's why she did it.
Mm-hmm.
That's a sad story right there. I mean, her husband, Lord.
She buckled those kids into the car seat before she let them drive into that water.
Yeah.
Like
So
that's, you didn't even give them a fighting chance. Like that's, I don't know. That's crazy. That's crazy. That's, that was a decision. That was, you had control. That was, yeah.
I think this past year she tried to get out and they said no. She still thinks the same way. I don't think she should ever be let out.
Oh,
if you
no.
watch the interviews that she has done recently, because I think they're allowing her to try to parole. She can sign up for every 2 years at this point now.
Wasn't she talking to men and getting money from men and having sugar daddies in prison?
Yep.
Yeah, no, you don't need to be. Yeah, that's wild.
Yeah.
You need to stay right where you are.
If you see the interviews that you've done, she's the same person. She hasn't changed. It hasn't helped her any.
Yeah. Yeah, no. Was she trying to claim, what was her, I'm trying to think. I'm trying to go back and think. I remember talking about this. Did she try to claim it was some kind of like insanity plea or anything?
No. She just lied about the whole thing. She blamed it on another person that wasn't even ever there. And
yeah.
Yeah, she was just I don't know. I think that one's just like pure evil to me. She is.
Yeah. Yeah, I agree. Same thing with what's her face? Diane Downs. Yeah, she was pure evil too.
Oh, Diane Downs.
Oh my God. You're a narcissist. I'm telling you about that woman. Oh.
Who here thinks of that woman every time you hear that song?
Oh, Hungry Like the Wolf.
Yes. Every time I hear that song, I think of that documentary.
She's a psycho.
Yeah.
She is a psycho. And she looks like Janelle Evans from Teen Mom.
Yeah, doesn't she?
She does.
Didn't she blame a black man as well?
Yes.
Okay, so there's 2 of them. They figure if they blame black people, it's okay, or what?
You know that the prosecutor for Diane Downs adopted her children that survived?
Yes.
Yep.
Yeah, I heard that.
That's wild. That's wild. Oh, man.
And she was totally diabolical. I'm telling you, that woman was.
Yeah, that key needs to be thrown away. Throw away the key. That's just, I don't even know what you would call that. That's pure evil, like you said. But these women, Andrea Yates, like there's a lot playing into that. I can see that woman breaking. and Lindsay Clancy, like she called out for help. I don't see these women being the same as Diane Downs and Susan Smith.
No,
You know,
no,
it's not the same. They're not the same.
not at all.
So, yeah, you know what? Now you got me interested, though. I'm gonna get off here. I'm not gonna lie. I'm gonna go watch that.
I can't wait to hear your thoughts about it.
Yes, I'm gonna go watch that, guys. If you guys can go watch that, we will reconvene later on tonight. I don't know if She Shed's going live or if one of you guys want to go live or I'll go live or whatever, but we will definitely go watch this. So everyone is getting homework. Go watch this, and we will reconvene later and let Jamie know our thoughts on it. So,
Yeah.
all right, guys. Good luck with the watching. I'll talk to you guys later.
All right, see you later.